Good evening, everybody. Good evening. And it is such a pleasure to be back here to teach you all and take you to the final class of radiology. So, in radiology, in the final class, what are we going to cover? Okay. What are we going to cover today? So, today we are going to cover the theoretical part of radiology. I have covered the most of the visual part. Only, I think, one or two more visuals are left, which we will cover today, but today we will look at more theory part. So today we will have to write down more. So I because some students will ask me later, so if you have some papers, please have some papers ready to write. If you need extra papers, please have them ready to you with you. Today we will talk about radiation physics. Okay, radiation physics. Okay, when I say physics, don't get bored. I will tell you only the what is required. Now, gradually in the entire medical education in India, today we have a vision to have more clinical orientation. So, if you have noticed in all my classes of radiology, I did not go too much into physics. I always was talking about what a clinician needs to know and what is the pattern of exam today, why we need to have an integrated approach to the MCQs. And but there are some radiation physics facts that we need to know, which I will cover today. I will also give you an idea about basics of radiotherapy, and I will also talk about nuclear scan, different nuclear scans like thyroid scan, Meckel's diverticulum scan, and I'll teach you how to look at them. Okay, so this is going to be my more or less the idea of the class today. And I would also want you to make sure that you make your notes, because it will be very brief notes, but they will be very useful to you for your revision. You can actually revise whatever I will teach you today. You can revise in half an hour if you make good quality notes with your own hand. Okay, let's start. Are you ready to start now, everybody? Yes? Okay. So if you're ready to start, I am going to open the first concept for you. The first concept is, whenever we talk about radiation exposure, we actually mean ionizing radiation. It is the ionizing radiation which can damage the tissue, which can cause DNA damage, which can cause harm to the human cells. We are talking about ionizing radiation. So it is very important that sometimes, okay, and I'm going to give you the first MCQ of today. Sometimes in the exam they will say, which of the following is a example of ionizing radiation? Can you let me know in the chat box which of the following is an example of ionizing radiation on the out of the following? Anybody? So let me answer. So ionizing radiation can be classified into two types: intranuclear origin, extranuclear origin. Okay, beta? Okay. Now tell me. There are two types of ionizing radiation. One which are originating from the nucleus of the atom, from the nucleus of a radioactive isotope. We will call them as intranuclear origin. Extranuclear origin means that these are the rays or radiation which are not produced by any isotope. Can I give you some example? Now please see. Intranuclear ionizing radiation are alpha rays, beta rays, gamma rays. Extranuclear ionizing radiation are X-rays. So some of you are saying CT scan, beta, and don't worry, mammography, all of them use X-rays. So we will say radiation is X-rays. CT is a machine. Radiation is X-rays. Okay. So ionizing radiation is, anybody? Intranuclear, extranuclear. Which of the following is extranuclear? X-rays. Which of them are intranuclear? Alpha ray, beta ray, gamma ray. Okay. Are you clear? And I want you to now understand that why I am telling you this small school level fact, because I know that you might have forgotten, and in our exams they ask such questions. For example, recently in the PGI exam, before PGI got merged with INICET, before INICET was formed, in the last PGI exam, they gave a question this: which of the following are ionizing radiation? So more than one answer was correct and you had to mark all of these. So don't think that they are not asking all of this. These are all important questions. Now let's go and make the second part of the notes. Second part is, what are alpha rays? Okay, so let us look at each one of them one by one. Okay, what are alpha rays? Anybody can tell me what are alpha rays? Alpha rays are nothing but helium nuclei. Alpha rays are nothing but helium nuclei. Again, please notice it has been asked as a question. Don't mark hydrogen nuclei, you will get a question wrong. Alpha rays are helium nuclei. How do we write? Okay, how do we write them? Okay, so Deepika is asking, sir, what are extra nuclear? Don't worry, I will explain to you. When I tell you X-rays, X-rays are not emitted from nucleus of a radioactive isotope. They are produced by extra nuclear mechanisms, which I will talk about. Okay, so how do we write helium nuclei? Everybody write it down. You have to write He4 plus 2. He4 plus 2. So the mass is 4, charge is plus 2. Everybody follows? Now anybody can answer. Anybody can answer my question. So sometimes they ask, alpha particles have how many protons, how many neutrons? They have 2 protons, 2 neutrons. So because neutrons don't have charge, so the total mass is 4, charge is plus 2. Alpha particles are made up of 2 protons and 2 neutrons. Everybody answers? Okay. Now if you are clear. Now what is the use of alpha rays in medicine? How do we use them in medical science? So first question, let's remember, alpha rays have no role in diagnosis of disease. Only role is in therapy. Okay. Alpha rays have no role in diagnosing the disease. So alpha rays we will never use in diagnostic purposes, only therapeutic purposes. Now alpha particles are heavy and charged particles. So did you notice they have a mass of 4 and charge of 2. So they are heavy and charged particles. Okay, heavy and charged particle. So one बच्चा is saying, यशस्वी ठक्कर is saying, sir electron कहाँ है? बेटा देखो मैंने बोला nucleus है helium का, atom नहीं है. It is the helium nucleus. So it is an ion. We have removed the electrons. That is why it is positively charged. Alpha particles are heavy and charged particles. So if they are heavy and charged, what does this mean? They have least penetration. Alpha rays have least penetrating power out of the radiation that we have talked about so far. Alpha rays, because they are heavy. But remember, if any time you see a question saying maximum ionization potential, maximum ionization potential is seen with. Now because alpha particles are having heavy weight, but they are charged. So when you affect a tissue with alpha particles, that area is totally ionized. So alpha particles, although they don't have too much penetrating power, but they have maximum ionization potential. Very important fact, very important question. Okay, so I am repeating for the children who have joined a little later. So far this is the first slide that we discussed. Ionizing radiation are of 2 types, intranuclear, extranuclear. इंट्रान्यूक्लियर में क्या लिखा मैंने? अल्फा, बीटा, गामा. एक्स्ट्रान्यूक्लियर में एक्स-रेज. And then I told you what are alpha rays. Alpha rays are helium nuclei. made up of 2 protons, 2 neutrons. They have no role in diagnosis, only in therapy. They are heavy and charged particle, least penetrating, maximum ionization potential. Maximum ionization potential. Everybody, will you be able to mark these answers? Okay. Now, can you give me some examples of isotopes which produce alpha rays? So most classic isotope that we have all heard of from school time is radium-226. What is radium-226? It is a alpha emitter. It produces alpha rays. Alpha rays. Okay. What is the importance of radium in medicine? What is the importance of radium in medicine? Anybody? First, it is the oldest isotope used in medicine. Okay. Anybody? Will you be able to mark it? Oldest isotope ever used in medical use was radium-226. It has a half-life of 1600 years. And this was one of the important half-life that was many times asked in the older pattern, and till now even in FMG screening exams sometimes they ask you this pattern. They will ask what is the half-life of radium-226. Okay, so I will not bore you with facts, but if I am giving you a value in my class, that means it is important and you need to know it for future reference. Okay. Number 3, radium-226 is no longer used. It has been replaced by other isotopes. The reason it is no longer used is it has harmful decay products. Because of harmful decay products, it is no longer used. Everybody gets it? Okay. Now, only thing you need to remember here of historical importance is, I don't know if you have seen in the earlier times, the people had watches where the dial was painted with radium. So the workers who were painting the radium dial of the watch, they used to put the radium paint, and like this they used to, please see, like this, put it in your mouth and then put it on the watch dial. So they develop osteosarcoma of the mandible. And this is one of the older pattern of exams that earlier they used to ask the historical importance also. So I will tell you what is the historical importance. Radium dial painters developed osteosarcoma of the jaw. Okay, strange. So that is the price of development, that a rich man was wearing a radium painted watch, but a poor man was developing osteosarcoma of the mandible, because people are not bothered about workers. So for many years nobody actually cared, and ultimately then we realized that this practice has to be stopped. So it is interesting to know history because it tells you that how medical science has evolved. Are you clear with this? So radium dial painters developed which cancer? Osteosarcoma of the jaw. Everybody understands this? Are you able to follow my points? Okay, I will give you one more question, beta. I will give you one more question. So suppose you are giving your exam and they change the question to radium-223. So this is not the classic radium. This is a new isotope. Radium-223 is a new isotope. Where it is used? Where it is used? Radium-223 is used for, it has a T half of around 11.4 days. It is used, it is a alpha emitter. If you give this systemically, it localizes to the bone. Hence, used for treatment of painful bone metastasis. We can call this as palliative treatment. Okay, everybody, are you able to understand this? So I am again repeating. So common thing between these two radiums is that both of them emit alpha rays. Are you clear, Thakkar? Yes, beta. So radium 226 alpha emitter, oldest isotope ever used in medicine, half-life 1600 years, no longer used, harmful decay products. In radium dial painters, the cancer that developed in the jaw was osteosarcoma of the mandible. Okay. Then we said radium 223, what is the use? It has a half-life of 11.4 days, emits alpha rays, treatment of painful bone metastasis. Useful for treatment of painful bone metastasis. That means if you give radium systemically, it will go to the bone and localize there, produce alpha rays, and then kill the nearby tumor. Then it will kill the nearby tumor. Everybody answers this? Okay. Let me ask you another question. The third, okay, Rimi Sinha is saying, sir, what is palliative? देखो, एक palliative का मतलब होता है you are doing symptomatic relief in a cancer patient, but you are not killing the tumor fully. समझने की कोशिश करते हैं. Palliative means symptomatic relief. Are you clear? Everybody understands, beta? Okay. Now, the third isotope which is important source of alpha rays is radon 222. Radon 222. Okay, anybody? What is radon 222? What is radon 222? Everybody tell me. Okay. So you will see this time I will make just simple notes for you. Very, very simple notes so that you are able to easily write down. Okay. Radon 222 is a radioactive gas. It has a half-life of 3.8 days. It is a source of environmental indoor radiation. It is the major source of environmental indoor radiation to humans. That means, try to understand, this means that when we are outside, suppose you are standing outside, so you are also exposed to cosmic rays. But when you are inside, your only source of environmental radiation, the major source of environmental radiation is radon 222. Okay. What rays are produced by radon 222? What rays? Alpha rays. Alpha rays. Now, if you are exposed to radon, it is a gas. Can you think and tell me where will it go? Suppose you are living in an area where the radon concentration is high and you are exposed to radon. Any one of you can answer this MCQ and tell me. Okay. Any one of you can tell me, if you give radon, where will it go? Anybody? Anybody? It's a gas you will inhale. So radon goes into your lungs. So, but it is an alpha emitter. So when it goes into your lungs, into your bronchus, alpha rays will bombard the bronchial epithelium and it can cause some mutations which can cause the cells to become cancerous. So that is why you must have read in your pathology book that it is a risk factor for lung cancer. It is a risk factor for lung cancer. Easy to understand now? Now this is one of the reasons why you must have heard of this, that non-smokers can also develop cancer. So one of the risk factor for lung cancer other than smoking is the major cause, is radon 222. Okay, everybody understands this? Everybody follows? It is a risk factor for lung cancer. Okay, so these are some questions that they can ask you on alpha rays. I will give you the, okay, so I'm just showing the slide again for Trisha. Trisha, I think, has come a little late today. So beta, please see with me. Also, I would want you to notice my style of making notes is also very important here, and this will also help you in other subjects also. Whenever you are making notes, see how I'm making my notes, and this is how I have been doing since my school days also. I make a box, it is a flashcard kind of a thing, and I write with bulleted points. Okay, and then I mark the keywords with a highlighter also. because I want to make sure that it is easy to revise later on, or it should be in points, not in paragraph, and these are simple flashcards that you are going to build up. ओम अश्विन इज आस्किंग रेडॉन का सोर्स क्या है? ये एनवायरमेंट है, एनवायरमेंट इसका सोर्स है. ओके ओके, it is not coming from, it is there in the environment. Okay, now let's see an answer beta. I'll give you the third question. Now advances. Okay, now there is a new isotope available which is a alpha emitter, which has never been asked in any exam. It is a new update. This isotope is called as actinium 225. Actinium 225. Okay, actinium 225. Okay, it is a source of alpha rays used for targeted alpha therapy. I will explain to you. I will explain to you. Everybody listen to me. Everybody listen to me. I am saying actinium 225 PSMA therapy is now a new thing. It has never been asked, but now it is a new kind of therapy available for. Can you guess which cancer? Can you guess which cancer? Can anybody guess which cancer? Anybody? Okay, anybody? Actinium 225 PSMA therapy, a targeted alpha therapy. One of you yesterday was guessing it. It is used for prostatic cancers. Prostate cancers, new therapy, but never asked so far. Can be asked in future. So today there is a new thing for alpha rays that is now come up. We have something called as targeted alpha therapy. The isotope used is actinium 225, and you bind it to PSMA for prostate cancers. Okay, so alpha rays are used for therapy, not for diagnosis at all. Okay, okay. And I see Jivesh has asked a question regarding the bone metastasis, etc. Don't worry, I will cover that also when I talk about phosphorus. Also, I'll talk about it again. Don't worry. So let's see the next radiation. Next radiation that I want to talk about is called as beta rays. It is called as beta rays. What are beta rays? What are beta rays? Beta rays are electron particles. These are electron particles which are emitted from the nucleus of a isotope. Okay. Beta rays are electron particles which are emitted from nucleus of a radioisotope. Okay, don't get confused now. The electrons from the nucleus are forming beta rays, but if you have extra nuclear electrons, then you will call them cathode rays. Don't get confused from your exam. So one bacha is saying what is PSMA. Vaibhav Shukla, PSMA कल मैंने बताया था. I will repeat for you. Prostate specific membrane antigen. Prostate specific membrane antigen. So what are beta particles? These are nothing but electron particles emitted from the nucleus of a radioactive isotope. Okay, now the question is, can you name some beta emitters? And what is the use of beta rays? Again remember, beta rays are again only used for therapeutic purposes, not for diagnosis. So are you clear at least by now that alpha rays and beta rays have no diagnostic role, only for therapy? Okay, only for therapy. Okay. So one bacha is getting confused and saying, sir, Mudita is saying, sir, electron कैसे आ सकते हैं nucleus से, है ना? अब बताओ कैसे आ सकते हैं? So this is the lacuna that you have studied physics in school, but everybody was trying to pass exams. You were not trying to understand. What is neutron? What is neutron? Neutron has mass of a proton, but no charge. Proton has plus charge, electron has negative charge. If a neutron decays, it can produce proton plus electron. ओके जितेंद्र, अगर एक न्यूट्रॉन डिके करता है रेडियो एक्टिव आइसोटोप में तो वो प्रोटॉन और इलेक्ट्रॉन बनाएगा. दिस इज हाउ इट हैपेंस. It is interesting to note that there are so many things. I'm sure you must have studied in your school days beta decay, isotopes which are decaying by beta emission, and they change into the neutron changes into proton, the atomic number changes. So I'm sure you must have studied and listened to all of them, but sometimes we are all getting confused. So my only things that you need in radiology for our purposes are these. Beta rays are electron particles, only therapeutic, not for diagnosis. Not for diagnosis. Okay. Now, let me ask you a question, beta. Let me ask you a question. Two isotopes which are beta emitters. Okay, these are beta rays emitters are phosphorus 32, strontium 89. And some of you might have noticed also, if you were able to follow my point, you will actually enjoy the process, because enjoyment of the process is the key. If you notice, radium, radon or radium 223 all had an atomic number more than 200, and I am sure in school they taught you that if you have an atomic number more than 200, the nucleus becomes unstable and starts to decay. It becomes so and alpha rays are emitted from isotopes with atomic number more than 200. Here the atomic number 3289, not okay, atomic number is not very high. Okay, so these are beta emitters. These are beta emitters. Anybody now tell me what is the half life of phosphorus 32? 14 days. What is the half life of strontium 89? 50 days. Okay, so only half lives that I am writing in the class you need to know by heart. These are important. Otherwise you can leave the half lives, but at least cover the ones that I am teaching in the class, है ना? Because I sometimes I meet children who say, sir मुझे कुछ याद नहीं करना, मैं सिर्फ समझना चाहता हूँ, I don't want to memorize anything. But if I am teaching something, that means you also need to remember it. That's all. Okay, now everybody, now tell me, my question to you is this: both of them are beta emitters and both of them are used for treatment, palliative treatment of painful bone metastasis. Both of them are used in palliative treatment of painful bone metastasis. Painful bone metastasis. Everybody understands? Okay. Now let me ask you a question. Let's see how many of you are able to answer my question. Very tricky, very difficult, but important from MCQ perspective. Both of them produce beta rays, but phosphorus produces beta rays which are more penetrating. They have more energy, more penetrating beta rays are produced, while strontium produces beta rays which are less penetrating. Okay, everybody now listen to me again. For the students who missed out, I am repeating. Both phosphorus 32 and strontium 89 are beta emitters. Both are used for palliative treatment of painful bony metastasis. But phosphorus produces beta rays which are more penetrating. Strontium produces beta rays which are less penetrating. So how does that affect us? Let's try to understand. Suppose, and I think I'll try to answer the question that Jivesh was asking. So everybody listen to me here. Suppose this is bone, and in bone you have a osteoblastic metastasis. Suppose you have cancer from prostate going into the bone. Suppose you have osteoblastic metastasis in the bone. Okay. So now suppose I give this patient systemically phosphorus 32. Now this phosphorus has a tendency to go to the bone. Now in the bone, where will it go? It will go where the bone formation process is actively happening. It will go and localize into the area where osteoblastic activity is happening. So phosphorus 32 will go and localize into the osteoblastic metastasis. Now, when it goes into the metastasis, what will happen? It will produce beta rays, it will produce beta rays, it will produce beta rays. What do beta rays do? Are they useful for diagnosing the tumor or they kill the tumor? Beta rays, are they useful for killing the tumor or diagnosing the tumor? They will kill the tumor. So surrounding tissue, beta emission will kill the tumor. Okay. Now my question is this, and I think one bacha has already asked, Siddharth Basu. Now tell me, Siddharth सोच के बताना है. अगर beta rays जो बनी, the beta rays that are getting formed, if they are more penetrating, they can cause damage to even surrounding tissue. What is there in the surrounding tissue? You have bone marrow. So phosphorus is now not recommended because it causes bone marrow toxicity, and strontium is safer. Are you able to understand this? That strontium 89 is preferred over phosphorus 32 because it is safer. Phosphorus 32 causes bone marrow suppression, just like one bacha already picked up, and that is the logic behind it. So if you understand the reasoning, then it is easy to understand in the exam if they say what is preferred for palliative bone metastasis now. The answer is strontium 89 more than phosphorus 32. Now also notice, if I write radium 223, radium 223 is preferred over strontium 89. Anybody can tell me why? The sequence is this. Why radium is even more safer? I will welcome Dr. Tushar in the chat box. Anybody now tell me? Anybody wants to tell me that safety wise, radium will be safer than even phosphorus and strontium. Why? Because radium 223 is alpha emitter, other two are beta emitters, and alpha rays even have even less penetrating power, more ionization, less penetration. So everybody understands this? So that is why always keep in mind, that is why our this radium is a new MCQ that they will ask you in the exam. Okay, everybody follows this? Clear? Everybody understands the logic? Okay. Now once you are clear, I will give you the next question to solve. The second more important beta emitter that you all need to know is iodine 131. Very often asked in exams, very important MCQ for you. Iodine 131. Anybody? Iodine 131 has a half-life of. Iodine 131 has a half-life of. Everybody? Half-life of iodine 131? 8 days. 8 days. Okay. Produces beta rays and gamma rays. Okay. Iodine 131 emits both beta rays and gamma rays. It produces both beta rays and gamma rays. But the important thing is, only beta rays destroy neoplastic tissue. Only beta rays kill in this particular case. Okay. Only beta rays destroy the neoplastic tissue. Now suppose you give iodine 131 to the patient, and I am sure you all can pick up iodine 131 will localize into the thyroid. It will localize into the thyroid. So what is the role? It is used for treatment of well differentiated thyroid cancer. It is used for treatment of well differentiated thyroid cancer. Clear? Okay. And secondly, everybody understands, it is also used for treatment of radioiodine treatment of Graves' disease. Iodine 131, what is the role? It is used for treatment of well differentiated thyroid cancer and radioiodine treatment of Graves' disease. Now Sahil Arora is saying, sir, why for well differentiated only? Because for iodine to kill the tumor, that tissue should uptake the iodine. वो टिश्यू को उसे आयोडीन को अपटेक करना है. So the thyroid tissue inherently has the ability to uptake iodine. But if it is anaplastic tumor, it will lose that ability. Then there is no effect on the killing of the tumor there. So it is only used for well differentiated, because only well differentiated tumors will uptake iodine. Okay, everybody now, but so for treatment part, only gamma ray, only beta rays are here useful. Iodine 131 also produces gamma rays, which help us in diagnosis part, which I will talk about with the gamma rays. When I tell you about more about gamma rays, I will talk about it. But beta rays is the reason why iodine 131 is used for treatment of well differentiated thyroid cancers and for treatment of Graves' disease. Also remember, if you give radioiodine treatment in Graves' disease, what is the risk? It can cause worsening of ophthalmopathy. So it is important MCQ to remember what is the problem with radioiodine treatment of Graves' disease. It causes worsening of ophthalmopathy, thyroid ophthalmopathy. Okay, Trisha is asked, sir, beta rays tumor को मारती हैं, gamma कहाँ काम आएंगी? Gamma rays will be useful for diagnostic purposes, which we will talk gradually when we reach to the nuclear scans and what is gamma camera. I'll tell you everything, but have patience, I will tell you. Okay. Now, let us now look at another isotope of iodine which will confuse you in the exam. Suppose they say iodine 123. Okay, suppose they say iodine 123. Then remember 3 lines about it. Half-life. What is the half-life? 13 hours. What is the half-life? 13 hours. Now iodine 123 is not easily available. It is not easily available because it is produced by cyclotron. It is produced by cyclotron. Do you remember from my yesterday class? Cyclotrons are big machines which are big particle accelerator, not available everywhere. So iodine 123 is a cyclotron generated iodine isotope with half-life of 13 hours. It produces gamma rays. Hence it is used for functional thyroid scan. Okay, when I will show you thyroid scan, I will come back to this concept again, that iodine 123 is used for thyroid functional scan. 131 for therapy, 123 for functional scan. Okay, not for PET scan बेटा, not for PET scan. PET scan में मैंने बताया था 18 फ्लोरीन, जब मैंने सिखाया था वहां पे फ्लोरीन था. Okay, now cyclotron is a machine which produces which accelerates particles, can help you to generate new isotopes. So cyclotron generated isotope like 18 fluorine was used in PET scan. Iodine 123 is used in thyroid scan. Okay, it can assess, Sheetal Tyagi, it can assess if you have a thyroid nodule and you want to know if it is functioning or not functioning. It will, iodine 123 scan will help you to find that function. But you have to know some more isotopes to cover the rare things. Sometimes they will say, what is iodine 125? So don't get confused. Iodine 125 has a half-life of 60 days. It is used in a special kind of radiotherapy called as brachytherapy. Now, don't panic. I will explain what is brachytherapy. As of now, it is enough to know brachytherapy means keeping the isotope in contact with the tumor. If you keep the isotope in contact with the tumor, that is brachytherapy. Okay. Now, secondly, it is also recommended to be used in radioimmunoassays. Which iodine isotope is used in radioimmunoassay? Iodine 125. Iodine 125. Okay. Now, I hope now you are able to understand that iodine 123 has only gamma emission, no beta emission. So it cannot kill the tumor. It can only help you to do a functional thyroid scan. It can help you to find out the function of thyroid, which we will talk about with the thyroid scan imaging. We will talk about it separately again. Just to cover two more updates, there is a new iodine isotope which is now being used in PET scan. It is called as iodine 124, useful for PET imaging. This is the only thing you need to know. And iodine 127 is the stable iodine isotope. So which iodine isotope is stable? Which iodine isotope is stable? Iodine 127. Iodine 127 is the stable iodine isotope. Which new iodine isotope is being used for PET scan? 124. Iodine 124. Okay. Again, iodine 125 is also a gamma emitter only. Okay. Okay. Now, all these half-lives help you to plan the treatment and plan the best shelf life of the isotope. Okay, how long can you keep it without it being decayed? When should you form it? When to so it has role in your management overall. Okay. Now Trisha is saying keeping isotope in contact मतलब कि अगर ट्यूमर की थेरेपी में if I keep the isotope away from the body, that has a different name, that is teletherapy. If I keep isotope in contact with the tumor, brachytherapy. Okay. Iodine 125 is also a gamma emitter. Pratyusha. Okay. Now let me ask you another question. Another beta emitter that I told yesterday, let's see anybody remembers. I told yesterday, I said yttrium 90. I said yttrium 90. Anybody? What is yttrium 90? Yttrium 90 microspheres are used in radioembolization treatment of HCC, which is called as TAR. Transarterial radioembolization. Okay. So again remember yttrium 90 is also a beta emitter. One more beta emitter I told yesterday, which is I'm going to revise again for you, was lutetium 177. Remember lutetium dotatat for neuroendocrine tumors. Any one of you? What was the ray which was killing it? Again, beta rays. Again, remember lutetium 177 therapy, which I had labeled yesterday as PRRT, peptide receptor radionuclide therapy for neuroendocrine tumors, again utilizes beta rays for therapy. So far we have understood, if you are able to somehow bring the isotope into the tumor, then the tumor is nearby, then beta rays can kill the tumor. Like if you give iodine, goes to the thyroid and it is killing the thyroid neoplasm, or phosphorus when it goes to the bone, strontium because phosphorus is related to bone, and strontium is related to calcium. Even that can go into the bone and kill the tumor. So the entire idea here is we are giving isotopes systemically and making them localize into the cancer, and then the beta rays are killing the nearby tumor. Okay. Okay, now let's see if anybody can answer. So I see Manoj Kumar is getting confused. Manoj Kumar, iodine 125 मैंने बताया गामा रेज बनाएगा, 124 पॉजिट्रॉन बनाएगा, तभी तो पेट में यूज करेंगे. 127 कुछ भी नहीं बनाएगा, वो स्टेबल है. Okay, it's not radioactive at all, it is stable. That is what I said. Iodine 127 is stable, 124 produces positron, 125 produces gamma rays. Okay. Now, when we have to send a isotope into a tumor, it has to be in forms of some microspheres so that it can be sent into the angiographic catheter. That is why there are microspheres. What is PRRT? Yesterday I had told, I think some of you did not attend yesterday's class. Peptide receptor radionuclide therapy. Clear? Peptide receptor radionuclide therapy, and TAR was trans arterial radio embolization. Okay, bache? Okay, I told yesterday, I think Durga did not attend yesterday's class, so that is not good. You should attend your class live. One thing that I have seen so far, and I'm sure you all will appreciate and agree, every time a class is happening live on your app, what will happen? You will have a tendency कि कल recorded देख लूंगा, कल थोड़ा सा और आराम से recorded देख लूंगा. Can you today tell me in the chat box कि वो कल कभी आता है? Is that, do you ever have a tomorrow that actually comes? होता ही नहीं है. You keep procrastinating, the recorded lectures keep accumulating, you're not able to do. You have to make a rule. If a class is happening live, you will attend it live. Don't procrastinate. Okay? Don't procrastinate. Very, very important. Otherwise, you will keep saying, कल थोड़ा अच्छा मूड होगा ना तब करूंगा, एक दिन ना अच्छा दिन आएगा तब पढ़ूंगा, एक दिन ना बिल्कुल पॉजिटिव मूड होगा ना उस दिन पढ़ूंगा. कभी होगा ही नहीं, एंड बढ़ता जाएगा, साल बीत जाएगा. इट्स वेरी वेरी इंपॉर्टेंट. ओके. So whenever you are attending, please attend live. Either if you are attending offline, good. If you are attending online, at least if it is happening live, please attend it live. Okay? Okay? Clear? Live attend करना है आपने. आगे चलते हैं अब, ठीक है? अब if you notice, with beta rays I have covered all the MCQs that can be asked around beta rays. Now I am coming to the third rays, which are gamma rays. The third rays are, okay, gamma rays. What are gamma rays? This is how we write gamma rays. Gamma rays are electromagnetic. Okay, I will write in full form. Electromagnetic waves. Gamma rays are electromagnetic waves which are intranuclear in origin. Gamma rays are electromagnetic waves which are intranuclear in origin. Okay. Now my question to you is this. There are two types of gamma emitters. There are two types of gamma emitters. Everybody listen to me. Okay. देखो मेरे साथ. High energy gamma emitters and low energy gamma emitters. Okay. Very important question coming up. Everybody, Shrikam, Trisha, Sahil, Swalia, beta, listen to me now. Swati, there are two types of questions that will be asked here. Okay? There are two types of gamma emitters. High energy gamma emitters, low energy gamma emitter. The high energy gamma emitter, the example is cobalt 60. Example of high energy gamma emission is cobalt 60. Low energy, technetium 99M. Technetium 99M. Okay. Everybody now tell me. I'm sure some of you will be able to answer my question. What is the role of high energy gamma emitters? What is the use of low energy gamma emitters? high energy gamma emitters are used for radiotherapy. That means we use them in a special cancer therapy machine, which is for teletherapy machine or a cancer therapy machine. We will talk about it. While technetium-99 is used for diagnostic purposes, it is used in nuclear scans for diagnosing a problem. Are you able to understand my question? The question here is this, that gamma rays have role both in therapy and diagnosis. This is the difference from alpha and beta. Alpha beta से अलग है ये. Alpha rays and beta rays are only used for therapy, not for diagnostic purposes. Gamma rays have role both in diagnostic radiology as well as therapy. Okay, so gamma rays are used both in therapy as well as diagnostics depending on the source of isotope. So I am repeating for all of you. कुछ ऐसे isotopes हैं जो high energy gamma rays बनाते हैं, कुछ ऐसे हैं जो low energy बनाते हैं. So there are isotopes like cobalt 60 which are producing high energy gamma rays, and there are isotopes like technetium 99M which are low energy gamma rays. These can be used to diagnose disease, they can be used to kill the tumor. Everybody understands the difference? थोड़ा सा concept आया, थोड़ा सा concept बना. चलो आगे देखते हैं फिर. So if you are able to follow my concept so far, now I hope I have made it all flowing for you, all these isotopes. So you just need to write like I am writing. These tiny notes will cover all the questions that you need to answer. So what is technetium 99? Okay, what is technetium 99M? Anybody? Technetium 99M has a half-life of 6 hours. It has a half-life of 6 hours. We write M with it because it is a metastable isomer that is being used medically. So because of being a metastable isomer, we write M on the side. We write M. Technetium 99M. M stands for metastable isomer. Metastable isomer. It produces gamma rays of energy 140 kilo electron volt. Okay, everybody, gamma rays are produced by technetium 99 have an energy of 140 kilo electron volt. I want all of you to see बेटा. किलो इलेक्ट्रॉन वोल्ट, किलो वाला जो एनर्जी है, किलो, ये इट कैन नॉट किल दी सेल. किलो इलेक्ट्रॉन वोल्ट पे, किलो वोल्ट पे यू कैनॉट किल दी सेल. सो इट इज यूज फॉर डायग्नोस्टिक पर्पसेस. इट इज प्रोड्यूस्ड ऑन साइट by a machine called as molybdenum 99 generator. It's a small generator which can be available on your lab or in your hospital. It is produced on site. मैं दोबारा से बता रहा हूँ, एक बार समझना मेरे साथ. Metastable means at a different energy level. So technetium 99 and technetium 99M are two isomers. Isomers मतलब होता है they have same atomic number but different energy state. So we call them isomers. Okay, now see, technetium 99M is being produced on site in the hospital site itself. You don't need to procure from outside. On the other hand, if I remind you, in PET scan we were using 18 fluorine, which is produced by 18 fluorine is produced from cyclotron. So you have to procure from outside. Okay, while technetium 99 is available on site. Okay, everybody follows? And I also want you to remember, very, very important question. You bind technetium 99M to a ligand. Different organ systems will have different ligands. I will give you an example which will help you to form the concept. Now please see these two examples with me, beta. ये दो एग्जाम्पल देखने हैं आपने बेटा, टेक्नीशियम MdP, टेक्नीशियम HEDA. Okay, now this is something that we've already talked about. I'm trying to give you the concept now. Please look at them and tell me what is the difference between the two. Both of them have the same radioactive isotope, which is technetium. The difference is in their ligands. MdP is methyl diphosphonate, so it goes into the bone. It goes into the bone. It is used for bone scan. HEDA goes into the hepatobiliary system. It is used for biliary tract, and for, we discussed, it was used for acute cholecystitis. Clear? Everybody? Are you able to understand this? So I told you that radiation physics is going to be slightly on the tougher side, but I will try to keep it only to the part that a MBBS student should know, nothing more than that. I will not give you anything extra, only that you need to know for MCQ purposes, beta. Okay, clear? So are you able to answer all the questions on technetium 99? Okay, so sometimes they will ask you the half-life of technetium 99. So half-life is 6 hours. It is a metastable isomer. Now some children were getting confused between isotopes, what is isomer and what is metastable. Let me explain. Anybody can tell me these terms from your school knowledge. अब देखते हैं स्कूल में कौन पढ़ रहा था, बताओ इनमें क्या फर्क होता है. What is the difference between isotope, isobar, isotone, isomer? Okay. Molybdenum 99 is the generator. Molybdenum 99 generator is a small machine that produces technetium 99 in the hospitals. So we use a molybdenum 99 generator. Isotopes are elements which have, anybody, same atomic number. Isobar, same atomic mass. Isotones, same number of neutrons. Same number of neutrons. Isomers are different energy states of the same element. So atomic number, everything is same, but the energy states are different, so we call them isomers. Okay, interesting. Isotope, same atomic number. Isobar, same atomic mass. Isotone, same number of neutrons. Isomer, different energy states. Okay, sometimes you might be wondering why am I telling you physics, but sometimes even this can be asked as a one-liner. So like we will make some short notes on radiation physics and isotopes, but maximum one or two question might come, but everything will come from your notes. So just make sure that you're writing whatever I'm telling. Technetium 99 is produced on the site of hospital itself by molybdenum 99 generator. The machine used to produce it, a molybdenum 99 generator. Okay, now okay, let's go further. Okay, now वन बच्चा हर्षित सिंह, किलो कैनॉट किल, मतलब देखो बेटा हर्षित, मैं आपके लिए दोबारा से बता रहा हूँ. इफ एन आइसोटोप इज प्रोड्यूसिंग रेडिएशन विद एनर्जी रेंज ऑफ किलो इलेक्ट्रॉन वोल्ट, तो सेल किलो इलेक्ट्रॉन वोल्ट की एनर्जी शॉक से मरता नहीं है. सेल को मारने के लिए मेगा वोल्ट वाला एनर्जी चाहिए. ओके, आप समझ आए हर्षित, समझ पा रहे हैं आप? ओके, सो आई एम अगेन रिपीटिंग the technetium, why it is a diagnostic isotope, because the energy is in किलो इलेक्ट्रॉन वोल्ट. किलो इलेक्ट्रॉन, जैसे मतलब आप सोचो ना कि कुछ थोड़ी सी एनर्जी से सेल मरेगा नहीं ना, इट नीड्स सर्टन थ्रेशोल्ड. ओके, किलो इलेक्ट्रॉन वोल्ट इज नॉट सो हाई, इट कैनॉट किल. For radiotherapy purposes, the isotope should produce energy in mega electron volt. Okay, I will explain gradually, beta, don't worry. Now, okay, I will show the isotope slide again to Shweta because she missed out. I'm just showing it to you, beta. Now please see with me. Same atomic number isotopes, same atomic mass isobar, same number of neutrons isotones, different energy states, different energy conformal states, isomer. Okay. Now HEDA scan, I think I have already covered. I think some bachas have missed out on the previous class. HEDA was hepatobiliary immunodiacetic acid. HIDA is hepatobiliary immunodiacetic acid. MDP is methyl diphosphonate. MDP is methyl diphosphonate. Okay, everybody clear? Now let's see further. है ना, अब आगे देखते हैं. बताओ. अच्छा, what is gamma camera? What is gamma camera? Now I want all of you to understand that we have given the patient systemic isotope. You have given the patient technetium bound to a ligand. It goes into the organ. Suppose this is the patient, you have given some isotope which has gone into the bone or it has gone into the gallbladder. Now tell me, any one of you can answer. What will the isotope produce? What will the isotope produce? Isotope will produce gamma rays, low energy gamma rays. But then we need a machine. We need a machine which can detect it and tell us the distribution of the isotope. So that machine is called as gamma camera. So nuclear scan images are obtained by a machine called as gamma camera. Nuclear scan images are obtained by a machine called as gamma camera. This machine was made by a man called as Anger. So we call it as Anger's camera. It is also called as Anger's camera. This machine has these detectors in it which can detect the gamma rays. These detectors are called as scintillation detectors. These detectors are called as scintillation detectors. Okay. Now Anand is saying, sir, can we not see this on a PET scan? Beta, PET और महंगी मशीन क्यों लेनी है जब इससे काम हो सकता है? Okay. PET scan is an advance over this. PET scan is more advanced than what we are looking at right now. PET scan तो इसके ऊपर वाली मशीन है, तो वो उतना क्यों हमें आगे जाना है? PET scan is using a machine which is looking at two dual photon peak. Here, this is the simple gamma camera. It is very low cost. PET scan will be much more expensive than this. Okay. So everybody answer this question quickly. In a nuclear scan, images are obtained by a machine called as gamma camera, which is also called as Anger's camera. Everybody understands? Clear? Okay. So we have seen how a nuclear scan is being done, and these are the ones that we have already covered. This was done in the bone. This is used for bone scan. This is what I taught you when I was teaching you acute cholecystitis. Happy everybody? Happy? Okay. Now let's see an answer, beta. Let's see an answer. Nuclear scan has two organs where it has been used for a lot of isotopes have a role in two organ systems. One is heart, other is kidney. So nuclear scan are okay. So let me take some questions. Shreya is saying, what are scintillation detectors? In the gamma camera machine, you have detectors which are called as scintillation detectors. When the gamma photon strikes them, they produce current, and we are able to detect it. We can detect the gamma photons using these detectors. Okay. They are made up of some sodium iodide doped with thallium. That is okay. We don't need to know it. Okay. Now my question to you is this: when I say scintigraphy, are you able to understand scintigraphy is same as nuclear scan? Okay. Nuclear scan is same as scintigraphy. Okay. Okay. So Anmol, I will talk about it. Anmol is saying, sir, gamma camera use कर लो, PET क्यों use कर रहे हैं? Now gamma camera has certain, nuclear scan has certain uses, but it cannot look at the metabolism. It cannot look at the glycolysis that like we learned yesterday in cancer. So PET scan has more wider metabolic role and more wider metabolic analytic capabilities than a nuclear scan. They are producing different set of isotopes. Okay. Now let's see an answer now, beta. Let us see if anybody can answer this. Cardiac scintigraphy or cardiac nuclear scans are of three purposes. One is called as myocardial perfusion scintigraphy, myocardial perfusion scintigraphy. Second is called as myocardial infarct scintigraphy. Third is called as ventricular function scan, also called as Muga scan. Okay, everybody, I want you to write down. To help you write down, I will zoom on each word so that you can read it. The first type is myocardial perfusion scintigraphy. The second is myocardial infarct scintigraphy. Second is myocardial infarct scintigraphy. Third is ventricular function scan called as Muga scan. Okay. Now, what we are doing in this is we are giving some isotope with bind to a ligand and it is producing gamma rays, and that is being detected by a machine called as gamma camera. Okay, Khushbu Sharma, happy? Now, let's see anybody can answer my question. Okay, I will show it to you. So, which isotopes are used for myocardial perfusion scintigraphy? The answer is, so look at the keyword. They will write this in the exam. Perfusion. Perfusion means blood flow. So the answer is thallium 201. Again, there is a problem with thallium. It is cyclotron generated, so not easily available. Myocardial perfusion scan is done with thallium scan. Thallium scan. Okay, I will tell you the full form, beta. Don't worry. Thallium 201. It is a cyclotron generated isotope. It is a cyclotron generated isotope. Okay, beta. Now tell me, anybody? So we need an alternative also, because cyclotron may not be available in the city. So, but technetium can be easily produced in the hospital itself. So we have an alternative called as technetium sestamibi scan and technetium tetrophosmin scan. So in the exam they will write like this. Okay, in the exam they will write like this. Which isotopes are used for myocardial perfusion assessment? Answer is, anybody say the answer, beta? Thallium 201, technetium sestamibi, technetium tetrophosmin. But why do we need technetium isotopes? Because thallium is cyclotron generated, may not be available. Okay. Now the question is this. Suppose you have ischemia in the heart. These isotopes, everybody listen to me. These isotopes, they concentrate in the part of the myocardium which is having blood flow. These isotopes, they concentrate in the part of the myocardium which is having blood flow. They come along with the perfusion. They come with the blood flow. If there is ischemia, the isotope cannot enter the tissue. Okay. So that means ischemic area will be cold on a thallium scan or cold on a myocardial perfusion scan. Ischemic area is cold. Now, what is hot and cold? I have answered this earlier also in a previous class. I will again tell you. Whenever we are doing a nuclear scan, that means nuclear scan means you are doing a diagnostic study by giving radioactive isotope to the patient. Whenever we are doing a nuclear scan, if the disease is accumulating the isotope, we will call it as hot. If the disease is not taking up the isotope, it is not becoming radioactive, we will call it cold. Okay. Now, anybody can answer? Myocardial ischemia on these perfusion scans will be cold. Okay. Now, see the reverse of it. The reverse of it is called as myocardial infarct scintigraphy. The keyword is infarct. The isotope used here is technetium pyrophosphate. The isotope used here is technetium pyrophosphate. Now this pyrophosphate binds to the dead tissue. It binds to the myocardial infarcted tissue. It is infarct binding. It binds to the infarcted tissue. As a result, infarct, myocardial infarct on technetium pyrophosphate scan will be, anybody, will be hot. Clear? Pyrophosphate scan on myocardial the infarct on pyrophosphate scan will be hot. Okay. Okay. Now, are you able to follow? Shweta, I am repeating for you. देखो, अगर if we have isotopes which follow the blood flow to the myocardium, so जहां blood flow होगी वहीं पे जा पाएंगे. If the blood flow is not going to a tissue, that area will be cold on these scans. But technetium pyrophosphate is different. It binds to the infarct. It binds to the myocardial infarct. So infarct on a pyrophosphate scan appears hot. Okay. Sneha and Shweta, I hope now you could follow by my repetition. Now, for assessing ventricular function, what is ventricular function? Ventricular function means these things. EF. What is EF? What is EF? Ejection fraction. What is EF? Ejection fraction. What else? Stroke volume. Stroke volume. What else? Myocardial contractility. Ventricular function means ejection fraction, stroke volume, contractility. Okay. To assess this on a nuclear scan, we use an isotope called as technetium RBC and then we call it Muga scan. Technetium RBC Muga scan. Muga stands for multi uptake gated acquisition. Full form is not required, but because you are asking, I am telling. Okay, because otherwise you will think sir ko nahi pata hai. But it is not important. It is not important. The full form is not important. The MCQ will say Muga because that is the popular name. Like Muga, nobody says full form. We say Muga scan karalo. Okay. Now, what is Muga scan? Technetium RBC Muga scan helps you to assess the ventricular function. But this is no longer the common thing that we do. For ventricular function, investigation of choice now is echocardiography. And the gold standard is, anybody can tell me in the chat box, what is the gold standard? What is the gold standard for ventricular function? What is the gold standard for ventricular function? Cardiac MRI. Cardiac MRI is the gold standard. So before advent of cardiac MRI, if we wanted to look at ventricular function, we were advising technetium RBC Muga scan. But now with more widespread availability of cardiac MRI, the gold standard is Muga scan. Gold standard is MRI. Okay, and I can see many of you are able to answer this. And I just wanted you to understand what vision we have, that on the eMedicos app recently we did for the radiology residents, we conducted a small course for cardiac MRI because many places cardiac MRI is not available. So we conducted a course on cardiac MRI on the eMedicos app. Now that videos are also available on the app in the CME section. So what we keep doing is I think it is in the resident teaching section. So what we keep doing is we keep looking at how we can bring value to the education system in the medical education system in the country. I keep thinking कि और क्या कर सकते हैं जिससे हम gaps को plug कर सकें education के अंदर. So even cardiac MRI course is now on eMedicos app. It is one of the few education apps which have the range that we are delivering today. Okay, so let's go further. So this is a short note, a small short note on role of nuclear scan in different cardiac indications. Okay, now another place is renal scan. Okay, another place is renal scan. Anybody? Renal scan means that we use isotopes in kidney also. In kidney there are two types of scans, nuclear scan. One is called as dynamic renogram Other is called as static renogram. Okay. जस्ट यू नीड टू नो टू थिंग्स. ओके, जस्ट दो चीजें, जितना मैं बता रहा हूं उतना ही जानना है, उसके ऊपर जानने का ही नहीं है, इतना ही जानना है. किडनी में दो तरह के न्यूक्लियर स्कैन हो सकते हैं, डायनेमिक स्टैटिक. डायनेमिक स्टैटिक. नाउ बिफोर आई गो ऑन, एक बच्चा कह रहा है सर आईओसी गोल्ड स्टैंडर्ड अलग है. देखो, इन्वेस्टिगेशन ऑफ चॉइस मीन्स द इन्वेस्टिगेशन दैट इज यूजुअली डन टू मेक अ डायग्नोसिस. गोल्ड स्टैंडर्ड मीन्स most accurate investigation, even if it is not done commonly, but most accurate investigation. अभी मैं समझाता हूं. देखो, सपोज करो आपके पास 500 के नोट है, ओके, और आपके घर में गोल्ड पड़ा हुआ है. सो कॉमनली you will take those 500 rupee notes to purchase vegetables and whatever you do. That is your investigation of choice, commonly done, usually enough. अब गोल्ड लेके तो नहीं जाओगे ना कि सब्जी लेनी है. So, but gold is the most important thing. So, gold is the most accurate, may not be used usually, but most accurate is gold standard. आप समझ आ गया? Okay, Harshil Anand. Okay, and AB is saying, sir, can you explain thallium and technetium? Thallium is the isotope which follows the myocardial perfusion. It is a potassium analog and it is produced by cyclotron. Technetium is an isotope which is used in many indications of nuclear scan. So if we add technetium to sesta maybe or to tetrophosmin, it follows the myocardial perfusion. Okay, now tell me everybody, renal scan, dynamic, static. So let me give you the example. Technetium DTPA scan. Everybody write down technetium DTPA scan, technetium MAG3 scan, technetium DMSA scan. Okay, everybody understands? Technetium DTPA scan, technetium MAG3 scan are dynamic renograms. DMSA is static renogram. Okay, now everybody try to understand. If we give technetium DTPA to the patient, this is excreted by GFR. It is excreted by GFR, glomerular filtration. It is excreted in the kidney by glomerular filtration. While MAG3 is excreted by glomerular filtration and tubular secretion. Okay, so try to understand. Both of them are dynamic, but the difference is DTPA is only excreted purely by glomerular filtration, while MAG3 is excreted both by glomerular filtration and tubular secretion. Renal function is a combination of these two. It is a combination of these two. So if they ask you which isotope scan is used for renal function assessment, you will mark technetium MAG3 is the best. While if you have to assess the GFR, which isotope scan is preferred? DTPA scan, technetium DTPA scan. Okay, so renal function, best isotope scan will be MAG3, but if they change the question, instead of writing function, if they write GFR, please change the answer to DTPA. Okay, both of them are indicative of function, but better for function is MAG3 because it is giving you assessment of all the components. GFR assessment is a different question where DTPA will be a better answer. Now what is static renogram? Static renogram means, listen to me everybody, static renogram means technetium DMSA. This is an isotope which concentrates in the renal cortex. ये किडनी के कॉर्टेक्स में जाके इकट्ठा हो जाता है. So how will it help you? So if you do a technetium DMSA scan, you can see the renal outline. And if there is any irregularity, any area on the cortex which is not taking up the isotope, we will be able to pick up. So it helps you to pick up renal scarring. It helps you to pick up renal scarring. So whenever they say investigation of choice for renal scarring, it is technetium DMSA scan. Why somebody will develop renal scarring? Because of, suppose if this is your urinary bladder, and suppose in this child the urine is refluxing into the ureter and going into the kidney, and it is causing damage to the kidney, and ultimately the kidney is developing scars. Kidney is developing scarring. Why? Because of reflux. But don't get confused in the exam. Suppose if they say investigation of choice to look for vesico-ureteric reflux, then what will you mark? Then you will mark MCU. Investigation of choice for vesico-ureteric reflux is MCU. Investigation of choice for renal scarring is DMSA scan. Then you should mark DMSA scan. Okay, everybody able to solve this? Are you able to mark the answers? Okay, very good. So this is a short flashcard on nuclear isotopes which are used for diagnostic purposes in kidney. In addition to that, there are GIT indications of nuclear isotopes. In GIT, we use technetium RBC scan. What is the role of technetium RBC scan in GIT in surgery? To localize the site of lower GI bleeding. Okay. Now, upper GI bleeding is easy. You will read about this in medicine and surgery, that upper GI bleeding is easy. You can directly put an endoscope and see the site of bleeding. Lower GI bleeding is difficult to localize. To localize lower GI bleeding, there are two alternatives. To localize lower GI bleeding, we can do either mesenteric angiography, selective mesenteric angiography, or we can do a technetium RBC scan. Okay, everybody? So lower GI bleeding can be localized either by a mesenteric angiogram or technetium RBC scan. So technetium RBC scan has the advantage that it is more sensitive. It can detect the site, it can localize the site even if the GI blood loss is as little as 0.1 ml per minute. Technetium RBC scan is more sensitive than mesenteric angiography. It can localize the site even if the GI blood loss is as little as 0.1 ml per minute. The value is also important. Okay. So out of them, which is more sensitive test? Technetium RBC scan is more sensitive to localize. It can detect the GI blood loss even if it is as little as 0.1 ml per minute. Mesenteric angiography can show you GI blood loss if it is as little as 0.5 ml per minute. Okay. So to localize the site of GI bleeding, both of them have been used, but minimum blood loss required for mesenteric angiography is 0.5 ml per minute. For technetium RBC scan, it is 0.1 ml per minute. So technetium RBC scan is more sensitive. It is able to pick up. Okay, everybody follows? Okay, so Jitendra is saying sir मुगा स्कैन, इसका मतलब अब IOC भी नहीं है और गोल्ड स्टैंडर्ड भी नहीं है. यस बेटा, करेक्ट. पहले होता था, अब लेकिन इसको दोनों में से हमने हटा दिया. With the advent of cardiac MRI, things have changed, and your your definitions also change with new technologies coming into play. Okay, everybody. Now So if this is what is going to be asked, how will you get confused in the exam? Exam में confusing कैसे होगी? Sometimes in the exam they might change the question and they'll say, what is the role of technetium heat damaged RBC scan? Anybody? What is the role of technetium heat damaged RBC scan? Now it will look to you कि question same है जबकि question बदल गया है. The question is not same. I have changed the question. Now what we are doing is we are taking the RBCs of the patient, damaging with heat, then labeling with technetium. And if you then systemically give this compound, what will happen? Tell me. It will not be used for GI bleeding. Heat damage. If the RBCs are heat damaged, they will be culled by spleen. Remember, damaged RBC are removed from the circulation by spleen. So it tends to localize in the splenic tissue. So it is useful to assess for residual splenic tissue after splenectomy. Okay. Sometimes in surgery they will give you a question. What is the investigation of choice to assess for residual splenic tissue after splenectomy? The answer is technetium heat damaged RBC scan. But you could analyze on the day of the exam. Heat से damage हो गए RBC, so spleen में जाएंगे. Then you could pick up the correct answer and mark it in the exam. What is happening in the real exams is that the people who are topping the exam are using their common sense on the day of the exam. जो लोग टॉप कर रहे हैं वो एग्जाम वाले दिन they are using a lot of common sense to reach to the answers. But other people are thinking कि इनको सब आता है, जबकि ऐसा होता नहीं है. They don't know everything. They are able to apply what they know to reach to the answer. Okay, clear? Everybody follows? So splenectomy is often done for some hemolytic anemias. So after you have done splenectomy, there could be some accessory splenic tissue. So the surgeon wants to know if there is something residual or not. You will do technetium heat damaged RBC scan. Okay, Shweta Jaiswal, are you clear, beta? कि मुदिता, do you understand? भाई स्प्लेनिक टिश्यू निकालना था किसी हिमोलिटिक अनीमिया के लिए, लेकिन स्प्लीन ना कॉम्प्लेक्स ऑर्गन होता है, उसके साथ में एक्सेसरी स्प्लीन्स भी होती हैं. तो आपने जो स्प्लीन देखा निकाल दिया, लेकिन आपको नहीं पता कि कुछ रह तो नहीं गया टिश्यू. अगर रह गया तो फिर वो फायदा नहीं होगा ना सर्जरी का, इसलिए. ओके, इन ऑल ऑफ दीज around the technetium that is used is technetium 99M. It is only the ligand which is changing. Isotope is common in most of the indication. Okay, now let's see one more example. Technetium sulfur colloid. Now if I take the same technetium and label it with sulfur colloid, anybody can tell me where will it go? Technetium sulfur colloid. So it must be a large molecule. Sulfur colloid, you understand, colloid must be a large molecule. So large molecule, if you give it systemically, will be eaten by your macrophages. So technetium sulfur colloid will be eaten by macrophages. So macrophages will take it to reticuloendothelial system. It goes into the reticuloendothelial system. Anybody can answer this question and tell me, and think of it, which hepatic lesion is rich in Kupffer cells? Which liver benign tumor is rich in Kupffer cells and appears hot on technetium sulfur colloid scan? Okay, anybody? Now before I go on, let me answer question. बच्चे देखिए, कोश त्रिशा, but don't let your imagination run here and there. Please see, you are saying splenic trauma, accident का पेशेंट आया, अब मैं उसको न्यूक्लियर स्कैन करने भेजूं कि फास्ट करके हीमोपेरिटोनियम देखूं? समझ रहे हैं कि नहीं? So don't rush here and there. Focus. Okay. So which hepatic lesion is rich in Kupffer cells? What are Kupffer cells? These are macrophages of the liver. So which will be hot on a sulfur colloid scan? The answer is focal nodular hyperplasia, FNH. FNH. Did I tell you about FNH yesterday? Yes, when I was telling you about the presence of central scar. FNH has central scar. Everybody remembers? Okay, Rakesh Chaudhary saying, sir, एक बार पिछली slide दोबारा दिखा दो. This was the previous slide. Only one line was written there. Okay? Okay, everybody clear? Now let's go further. Suppose in the exam they mention the word technetium pertechnate. Suppose in your exam they mention the word technetium pertechnate scan. Then what do you think? Technetium pertechnate means technetium pertechnate means technetium O4 minus. Just like in school they must have taught you peroxide. Remember peroxide is O2 minus. So pertechnate is technetium O4 minus. This technetium pertechnate has some very important role in your diagnosing diseases. It is very important from exam perspective. So listen to me very carefully. Technetium pertechnate is okay. Vijay Lakshmi and Khushbu are saying sir last slide रह गया. अब देख लो दोबारा से. Okay. Are you able to see now the last slide? Hepatic lesion which is rich in Kupffer cells, which is hot on technetium sulfur colloid scan, is FNH. What is FNH? Focal nodular hyperplasia. Okay, I'm zooming out, beta. Technetium sulfur colloid is taken up by the macrophages, goes to the reticuloendothelial system. Okay, beta. अब तो हो गया. चलो, let's go further. Now, technetium pertechnate is physiologically taken up by choroid plexus in our brain, salivary gland, thyroid gland, gastric mucosa. Okay. Also, maybe we can write lactating breast. That means during lactation, we should not do this scan because otherwise breast tissue will get radiation exposure. So, physiological uptake of technetium pertechnate is seen in, please listen to me, choroid plexus, salivary gland, thyroid, gastric mucosa, lactating breast. Okay, clear? Now, so how this is used clinically, I will tell you. How this is all used clinically, I will show you. Remember now, let's see the first word. Okay, let's see the first word. Everybody, see it with me. Suppose I tell you salivary gland. So, normal salivary gland should uptake, technetium pertechnate. So, suppose if you have a tumor, in the salivary gland, anybody now? Okay, so I think Diksha Shrestri will tell us. अगर ट्यूमर है सलाइवरी ग्लैंड में तो क्या होगा? नॉर्मल सलाइवरी ग्लैंड में टेक्नीशियम परटेक्नेट का अपटेक है. इफ देयर इज अ ट्यूमर देयर, व्हाट विल हैपन? टेल मी. नाउ कैंसर टिश्यू विल हैव लॉस ऑफ फंक्शन. कैंसर है तो देयर विल बी लॉस ऑफ फंक्शन. So tumors in salivary gland are usually called on a pertechnate scan. I think Nandini got it right. Very good. Anybody? Tumors in salivary gland is called on, tell me, called on technetium pertechnate scan. But that means there should be exception. Which salivary gland tumor is hot on a nuclear scan? Okay. Surgery question now. Anybody can answer. Which salivary gland tumor is an exception to the rule and it is hot on a technetium pertechnetate scan? Okay. Which salivary gland tumor is an exception to the rule and it is hot on a technetium pertechnetate scan? And you will read this in your surgery book also. That is Warthin's tumor. Warthin tumor has both adenoid, and that means it has the glandular component as well as lymphoid component. It is called as adenolymphoma of the salivary gland. Adenolymphoma of the salivary gland, and because of the lymphoid tissue, it is taking up the isotope. So remember, a tumor of the salivary gland which is hot on a technetium pertechnetate scan is Warthin's tumor. Very important question, can be asked in your exams. So this is the clinical application of the fact that I told you. I will tell you one more application, but you will have to give me just 1 second to load the image. I will load the image for you. Let's see, anybody can see and answer this. Let's see this image together, beta. है ना? Everybody see this image? This is a technetium pertechnetate scan of the abdomen. This is a technetium pertechnetate scan of the abdomen. We can see there is uptake in the gastric mucosa. There is uptake in the stomach. In the gastric mucosa, you can see there is uptake. Okay. And the isotope is excreted by kidney, so there is accumulation of isotope in your urinary bladder. That is excretion of the isotope. Okay. Everybody, please see the screen. There is a very important MCQ coming for you. This is a technetium pertechnetate scan. Technetium pertechnetate is known to physiologically accumulate in the gastric mucosa. It is excreted in the urinary tract, goes to the bladder. So you see that uptake in the bladder. But the question is, what is this structure? The page number is here 120, and identify the arrow mark structure. Identify the arrow mark structure. This arrow mark structure is Meckel's diverticulum. The arrow mark structure here is Meckel's diverticulum. Why we are able to see Meckel's diverticulum? Because of presence of ectopic gastric mucosa. Because of presence of ectopic gastric mucosa. Okay. And Meckel's diverticulum investigation of choice, technetium pertechnetate scan. Investigation of choice for Meckel's diverticulum, technetium pertechnetate scan. Everybody able to answer this? Okay, so I hope you were able to identify the Meckel's diverticulum, and I can see most of you are able to answer also because of the ectopic gastric mucosa. This technetium pertechnetate is also taken up by the thyroid. It is also taken up by the thyroid. So what happens is, in thyroid, if the iodine 123 is not available, do you remember I told you iodine 123 is produced by cyclotron? Iodine 123 is produced by cyclotron, may not be available. So if iodine 123 is not available, we use technetium pertechnetate. Let us try to see the normal thyroid scan. This is how the normal thyroid scan would look like. Okay, this is how the normal thyroid scan will look like. You will see uptake in both the lobes of thyroid like this. We can use iodine 123. We commonly use technetium pertechnetate. Commonly we use technetium pertechnetate for thyroid scan. Okay. Now I will show you the example now. Now suppose a patient comes to you with hyperthyroid status. The patient comes to you with hyperthyroid status. Hyperthyroid. Okay, listen to me everybody. Okay, Manoj Kumar, bladder accumulation in this case was normal. It is not uptake, it is actually excretion. Urinary excretion in that case is normal. Yes. And Meckel's diverticulum is hot. Yes, because of the ectopic gastric mucosa beta. Okay, Nandini, do you understand? Bladder में hot इसलिए है, bladder is hot इसलिए because the any isotope you have given systemically has to be excreted by your urinary system, so it has gone into the urine. Okay? Okay, beta. Now tell me, suppose you have a patient who is hyperthyroid, and you have a thyroid scan looking like patient A, patient B. What is the difference between the two? Okay, let's see. I am going to remove myself so that you can see clearly. So please see, patient was hyperthyroid, but your thyroid scan is different. In one patient it is having diffuse increased uptake. In one patient there is increased uptake. In second you have reduced uptake. What is the difference? If you see generalized increased uptake of the isotope, what do you think we're dealing with? We're dealing with, anybody? Graves' disease. You're dealing with Graves' disease. Okay, that is Graves' disease. And if there is loss of function, that means there is inflammation happening there, then you think of thyroiditis. So again, this is a possible question which can be asked in your exam, that entire of the gland is having reduced function, but the patient is hyperthyroid. That means his hyperthyroidism is because of the leaking of hormone that is happening in thyroiditis. Everybody understands? So this is thyroiditis, this is Graves' disease. Okay, so both of them will be hyperthyroid in the MCQ, don't get confused. This is how the clinical correlation will happen. Okay, now third question. Sometimes you will see multiple hot nodules in the thyroid on a thyroid scan. This is called as toxic multinodular goiter. Toxic multinodular goiter. And if you see a single hot nodule with suppression of rest of the gland, rest of the gland is suppressed, only one hot nodule is there, then we call it toxic adenoma. Okay, then we call it toxic adenoma. And you might, some of you, okay, I will put them all in one slide. This is this image that I'm showing you from my image book, same to same image they have taken and asked in a INI-CET or a AIMS exam in the past. Very important. And next time they might ask you these. So keep in mind that it is important that if I am showing something, it is because these are likely topics for undergraduate to be asked. Okay, so this is how thyroid scan looks like. In thyroid scan, we need to remember this. Very important. A hot nodule, everybody remember, a hot nodule on thyroid scan is always benign. A hot nodule on a thyroid scan is always benign. Okay, now अभी मैं दोबारा से बता देता हूं. आई थिंक बच्चे कह रहे हैं सप्रेशन क्या है. गोकू तिवारी प्लीज सी, एक नॉड्यूल बहुत ज्यादा एक्शन दिखा रहा है तो बाकी का एक्शन सप्रेस हो गया. आयोडीन अपटेक, आयोडीन जो आइसोटोप अपटेक था इसी में ज्यादा हो रहा है, बाकी में सप्रेस्ड अपटेक हो गया. एंड प्रियदर्शनी एंड आई थिंक त्रिशा एंड भरत वाज सेइंग थायराइडाइटिस, और इसमें क्या फर्क है. देखो, Graves' disease, you all know Graves' disease leads to increased uptake of the isotope in the thyroid gland. Okay, that is very easy. But if the question is saying hyperthyroid, but the image is like this, reduced uptake, then mark thyroiditis. Thyroiditis is also one of the causes where the patient initially will have hyperthyroid state because of the inflammation, the hormone is getting leaked into the circulation. So thyroiditis में भी शुरू में hyperthyroid होता है, तो भूलना नहीं है, स्कैन जरूर देख लेना. ऐसा ना हो इफ यू सी hyperthyroid and you mark Graves' disease. No. Okay, clear? Okay. So what I'm saying here is, if you ever see a hot nodule on a thyroid scan, it is always benign. It is the cold nodules which need to be evaluated for malignancy. Why? Because loss of function is a sign of cancer. So cold nodules should be evaluated for malignancy. Hot nodules in thyroid scan are almost always benign. Hot nodules are benign. cold nodules can be cancer. But do not get confused. Not all cold nodules will be cancer. Okay? Not all cold nodules will be cancer. So there will be a small percentage which will turn out malignant. Not all of them will be malignant. So cold nodule need to be evaluated further. Okay? Now let's see an answer, beta. Let's see an answer. Now एक बच्चा कह रहा है सर solitary thyroid nodule will be toxic. Depends कि वो nodule hyper functioning है या नहीं है बेटा. See, toxic adenoma, Anmol Tyagi, is a single nodule which is hyper functioning. Okay? Clear beta? Anmol? Okay. Now my question are these beta. ठीक है? Now iodine भी we can use for thyroid scan. We can use for technetium also. So we can use iodine 123 also. We can use technetium 99M also. Technetium pertechnate also. So out of them, which is more accurate? Out of them for thyroid scan, which is more accurate? Iodine ज़्यादा accurate है कि technetium ज़्यादा accurate है? Out of them, the more accurate is iodine 123. More accurate is iodine 123. Now imagine now, let us imagine now, suppose you have a nodule which is cold on iodine scan, hot on technetium scan. That means the report is discordant. Okay. Suppose, Lahiri, please see an answer, beta. Suppose you have a discordant nodule which is hot on technetium scan, cold on iodine scan. So if I look at the report, if I look at the technetium report, ऐसा लगता है कि ये benign है. It looks benign because hot nodules are benign. But when I look at the iodine report, it looks cold. It could be a cancer. So what should I do? I should evaluate for cancer. Because iodine is superior, I should evaluate for cancer. So if in confusion, if the reports are in confusion, if they are discordant मतलब दो टेस्ट है अलग अलग रिपोर्ट बता रहे हैं, you should always favor the iodine report because iodine is physiologically taken up by your thyroid gland. So iodine gives you more information as compared to a technetium scan. Okay. Okay, technetium is the isotope beta Yogeshwari, and if you add it to pertechnate, so when I say technetium, I mean technetium pertechnate. Technetium M is the isotope, O4 minus I have added to make pertechnate beta. Okay. सो साक्षी सलाइवरी ग्लैंड में और थायराइड में साक्षी सेम बात है. देखो थायराइड भी और सलाइवरी ग्लैंड भी फिजियोलॉजिकली टेक्नीशियम परटेक्नेट को अपटेक करता है. इफ देर इज अ कैंसर देर विल बी लॉस ऑफ फंक्शन. ओके okay. So Nandini is saying, sir, do we have to do both these kinds? No, we don't have to. It is just one condition, one problem. Suppose you have done both these scans and now you are in trouble, then you should evaluate for cancer. That is what I'm saying. Okay. And to do evaluate for cancer, we will need to do tissue diagnosis there. So that is the idea. Can we use any other investigation other than thyroid scan? We can also use thyroid ultrasound. Very important question. We can also use thyroid ultrasound. It is very common nowadays. It is very common nowadays to have a thyroid nodule, especially in the iodine deficiency belt in India. So not every of those nodule will be cancer. So we can do a ultrasound also of the thyroid to assess the thyroid nodules. On ultrasound, we calculate a score called as thyroid imaging reporting and data system. Thyroid imaging reporting and data system. It calculates the score based on shape of the nodule, margin of the nodule, echogenicity, composition, presence of echogenic foci. Okay. So let me repeat for Rimi Sinha and Shweta Jaiswal. बेटा डिस्कॉर्डेंट का मतलब था, डिस्कॉर्डेंट मतलब था कि रिपोर्ट अलग अलग आ रही है। देखो देखो मैंने कहा बताया था, देखो देखो मैंने बोला आपने एक पेशेंट का टेस्ट किया, टेक्नीशियन कह रहा है हॉट है, आयोडीन कह रहा है कोल्ड है, दो अलग अलग रिपोर्ट आ गई ना। हॉट बिनाइन होता है, ये कैंसर हो सकता है, तो एक कह रहा है बिनाइन हो सकता है, एक कह रहा है कैंसर हो सकता है, डिस्कॉर्डेंस होगी ना। डिस्कॉर्डेंस मतलब दोनों में दो लोगों में रजामंदी नहीं हो रही, डिस्कॉर्डेंट है। देन वी नीड टू go with the superior one. Iodine 123 is preferred. Okay. So I am again repeating for all of you that, okay, I am repeating for you, for thyroid nodules, you can do an ultrasound and calculate the thyroid score. Thyroid score will tell you that do we need to do a biopsy or a FNAC or not, or is it enough to, ignore it. So thyroid score is based on shape, margin, echogenicity, composition, echogenic foci. Can we remember? This is the components of thyroid score. So two questions, only two questions you need to know. Thyroid score is calculated on thyroid ultrasound. Thyroid ultrasound. It is based on 5 properties, which are shape, margin, echogenicity, composition, echogenic foci. Okay, Radhika, it was actually the other way around. First technetium is done here and then somebody advised iodine and then we got the discord. Shreya is saying, so 3 or 5 mein kya farak hai? Let me say. Echogenicity means, is the nodule hyperechoic or hypoechoic? Cancers are usually hypoechoic. Echogenic foci means presence of microcalcification. Small calcification in a nodule will look echogenic. Microcalcifications are seen in cancer, we have already talked about. So all these, this is the meaning of it. So, Hanji, let's get back to track. We are in it to win it. So let's start with the remaining part of the class, so that I'm so happy to see you all excited and all charged up, because the entire idea is you should be happy about what you're doing. You should not feel like work. अगर काम जैसा लग रहा है तो बात ही नहीं बनेगी. You should feel happy, you should feel excited कि यार ये अपने लिए कर रहे हैं, पढ़ने के लिए कर रहे हैं, सीख रहे हैं कुछ, है ना. So that is the key. So let's go forward and let's get back to where we were. So we have seen about the different tumors on technetium pertechnetate scan, how they look like. Let me take a question. Deepika ने पूछा कि सर small bowel perforation में बेरियम क्यों नहीं देते? Because if it goes into the peritoneum, it causes peritonitis. फिर वो कह रही है कि सर esophagus में क्यों देते? Because in esophagus, if the barium if there is perforation and barium goes into mediastinum, it only causes some mild inflammation. It is not clinically relevant. That is why. Okay, Deepika? Okay. Now let's start with the next investigation. So far we have learned that in nuclear scan, this is the patient, this is your gamma camera. So far we have learned that this is your gamma camera, this is the patient, and we are trying to look at the gamma radiation emitted from the isotope. Now my question to you is this. My question to you is this, beta. All of you, let me know in the chat box. A nuclear scan is a two-dimensional investigation or three-dimensional investigation? Okay? Anybody tell me? Anybody? Nuclear scan is a two-dimensional investigation or is it a three-dimensional investigation? It is 2D. It is two-dimensional investigation. It is a two-dimensional because we are only looking at it from one plane. We are looking at the distribution of isotope in one plane. So we can say it is a planar imaging. It is two-dimensional. Now let us imagine now, suppose you are an engineer, suppose you were a scientist. Okay, suppose you were a scientist, and suppose this is the patient. Suppose this is the patient. Suppose you invented a machine where this is one gamma camera and this is another gamma camera. Suppose you invented a machine where you have gamma camera above and below the patient and you are rotating them around the patient. So this gamma camera is not static, it is rotating around the patient. Rotating around the patient. Can you tell me what will be the advantage? Can you tell me what will be the advantage? Now you can look at the distribution from all ends. That means we are going to look at a 3D investigation, three-dimensional investigation. This investigation is called as SPECT. What is SPECT? Single photon emission computed tomography. Okay. So what is SPECT? SPECT is just like a nuclear scan. It is just like a nuclear scan. The only difference is that it is 3D. The only difference is it has 3D capability. It is a machine where the gamma cameras are rotating around the patient to give you the 3D image. Okay, so it uses the same isotopes as a nuclear scan. Same technetium 99M, iodine 123. Same isotopes are used in SPECT scan. Nothing else is the difference. So suppose they ask you what is the difference between a nuclear scan and a SPECT scan. The difference is SPECT scan is 3D, nuclear scan is planar or 2D. PET scan is very different. Remember, PET scan, the entire technology was different. In PET scan we had, remember, different isotopes, different machine which was producing positron. So PET is very different technology. SPECT and nuclear scan are related technology wise. This is 2D, this is 3D. Okay, everybody understands? Everybody follows? Okay, now let us go further now. So far all we have done is, I have said the nuclear scan that we have studied so far in the class was two-dimensional. So this is what we saw so far in the class. It is a two-dimensional investigation. But suppose you have gamma cameras in front and behind the patient and they are rotating. You will be able to get a 3D picture. This is called as single photon emission computed tomography or SPECT. The test is called as SPECT. Okay. What isotopes are used in SPECT? Technetium 99M, iodine 123, same as a routine isotope scan. काटकट श्रीनाथ इज सेइंग कि काटकाम श्रीनाथ इज सेइंग कि सर जैसे एक्सरे और सीटी में था बिल्कुल वैसे ही एक्सरे 2D था सीटी 3D था वेरी गुड बेटा आई थिंक यू हैव पिक्ड इट अप द राइट एनालॉजी टू अंडरस्टैंड दिस everybody understands this now what are the clinical places where SPECT is used SPECT is used for parathyroid tumor localization okay PET is equivalent to parathyroid tumor localization. कैसे करेंगे? See, now I'm sure many of you know this or not that suppose you have a parathyroid tumor. Now the location of parathyroid can be variable. So it can be, it's not necessarily present in one location because of its complex embryology. It could be variably located. So pre-operatively, the surgeon wants to localize the tumor so that he can go minimally invasive and just find the gland and the tumor and remove it. Okay. So how will you do pre-operative parathyroid tumor location? Okay. Now this becomes a previous INI CET MCQ. How will you do parathyroid adenoma? Common tumor here is adenoma. How will you do a parathyroid adenoma localization? Bolo? Preoperatively, the answer is technetium sestamide SPECT. So the test or the scan which is done here to preoperatively localize a parathyroid adenoma is technetium sestamide SPECT. Everybody understand this? And this has been asked in your previous AIMS exams as well, that which investigation will you advise to pre-operatively localize a parathyroid tumor? Technetium sestamide SPECT. Why SPECT? Because SPECT is a nuclear scan which has 3D capability. So if it is available, it is better to get the 3D feel where exactly the adenoma is. Okay. Now any other investigation? So, but if they say what is the best investigation, this is the IOC, investigation of choice. But if they say what is the best or the most accurate investigation for parathyroid adenoma or parathyroid tumor localization, if they say what is the best or most accurate investigation, investigation of choice तो सस्ता में भी है, but what is the best investigation? Anybody? Best कौन सी होगी? Anybody? Now we believe that best investigation for parathyroid adenoma localization is a 4-dimensional CT scan. Okay, so this is a possible future MCQ, 4-dimensional CT or 4D CT. Clear, beta? Everybody understands? Okay, let me just see it in a bit. Okay, clear? So what do we mean by this 4D CT? 4D CT means that to localize a parathyroid adenoma, you should see parathyroid in 3 planes. What are the 3 planes? Axial section, coronal section, sagittal section. Okay, take the sections of parathyroid area in 3 planes: axial, coronal, sagittal, so that you don't miss the tumor. But then it should be 3-dimensional. Why it is called as 4-dimensional? Why it is called as 4-dimensional then? The 4th dimension is look for contrast enhancement. After giving IV contrast, take the images in arterial phase and delayed phase. Take the images in arterial phase and delayed phase. So if we evaluate the tumor for these things, look for the tumor, because it could be a very small tumor. So look for it in 3 planes, look for it in the arterial phase, delayed phase. This is called as 4D CT. It is considered most accurate for parathyroid tumor localization. However, there are some concerns about radiation exposure to thyroid. There are some concerns about radiation exposure to thyroid. And I'm sure, if you are doing a CT of the thyroid area, again, arterial phase, delayed phase, we are exposing thyroid to radiation. Theoretically, there is a risk that if thyroid gets radiation, there can be a neoplasm called as papillary cancer thyroid which can develop. So theoretically, there is a risk. So that is why we are not recommending it as IOC. That is why, although it is the most accurate thing to be done, sestamibie scan has less radiation exposure. So that is why people are saying, let us say IOC sestamibie scan hai, go best पूछा तो 4D CT. Okay, clear? Everybody understands? Okay, so that is because of the theoretical risk of radiation concern that we have when we do a CT scan of the thyroid area, we are not calling it as investigation of choice. We are not calling it as investigation of choice. Okay, but we can call it as the gold standard because this is the one which is most accurate. Even if we are not doing it often, it is the most accurate thing. Okay, everybody clear? Okay. Any other place where we use a SPECT scan? There is something called as iodine 123 ioflupane SPECT. Okay, there is something called as iodine 123 labeled ioflupane PET. Okay, ioflupane SPECT. Now this isotope that I am telling you here localizes to the dopamine transporters or dopamine receptors. It is going towards the dopamine area in the brain. Anybody, have you heard of this before? This is called as DAT scan, dopamine transporter scan. And if you look back in your workbook, when I was telling you Parkinson's, I told you DAT scan. I told you that this isotope in DAT scan in the normal person, in a normal person, will localize in your striatum. It will localize in your striatum in the caudate and the putamen, caudate and the putamen, and the appearance will be like comma. Okay, comma like uptake. Here ioflupine is the ligand, correct beta. So comma like uptake is seen in, tell me, normal person. It is the normal pattern. While if you have a patient who has Parkinson's, if you have Parkinson's, then what will happen? The uptake in the striatum will be reduced. So uptake will be like this. Uptake will be reduced. Okay. So what is that called as? What is the what do we call full stop in when I'm spoken English, when I'm speaking? How do I say full stop? Then we use a word period. Period. So period like uptake is seen in Parkinson's. So that means if you see comma like uptake but the patient has trauma, it could be a physiological tremor that is happening in him. So this helps you to understand that this is also a SPECT scan. So that scan that I have shown you in the image book during Parkinson's, that was a SPECT scan, called as DAT scan, where we are using iodine 123 labeled ioflupane as the agent which is going to localize in the striatum. Okay. So you might have, some people are not able to follow, so let me explain to you that you might have seen some people who have good English. So whenever they will say and speak to you, they will say, I have told you enough times not do period. So what is period? Full stop. Okay, don't ask after that. Okay, earlier, because we were from small school, earlier I could not understand what do they mean. Now I know period means full stop. Okay, okay beta, now let's go further. Let's go further. Any other isotope which produces gamma rays? Cobalt 60. Any other isotope which produces cobalt 60? Which produces gamma rays is cobalt 60. I will explain to you. Cobalt 60 is a radioactive isotope which decays into nickel 60 and produces gamma rays. Okay, everybody remember, अनमोल चौहान कह रहा है कि सर पार्किंसंस में तो कॉर्डेट और पोटामिन इन्वॉल्व ही नहीं होता. व्हाट इज पार्किंसंस? Parkinson's is a nigrostriatal abnormality. So there will be problem in substantia nigra as well as in striatum. Okay. Now tell me beta, cobalt 60 decays to Anmol Tyagi. Again, second question also that you are asking is not right. है ना? Anmol Chauhan and Anmol Tyagi. Don't worry. Now tell me beta, आप बताओ. Cobalt 60 decays into nickel 60 plus gamma rays. These gamma rays have an energy of 1.25 mega electron volt. I hope you are able to remember that in normal physics the unit of energy is joule, but in quantum physics the unit of energy is electron volt. Remember, electron volt is a unit of energy. So gamma rays emitted from cobalt decay have a energy of 1.25 mega electron volt. Okay, I will explain better, don't worry. It has a energy of 1.25 mega electron volt. So Asmita Patidar and everybody who's listening to me right now, please tell me, ये जो 1.25 mega लिख दिया, mega electron volt, that means much higher than the energy that we saw earlier. So if you give this much energy, it will kill the tumor, it will kill the cells. Okay, so that means there are machines available called as cobalt machines which are used to provide radiotherapy, which is called as teletherapy. What is teletherapy? Where radiation source is kept away from the body. Okay. What is teletherapy? If the radiation source is kept away from the body, tele matlab dur, teletherapy, then we use a term teletherapy. It's a kind of radiotherapy. So cobalt 60 is high energy gamma emitter. It is used for in cobalt machines as a teletherapy unit for to provide teletherapy. Everybody clear? Now, the only thing that we need to know here is nowadays for teletherapy, one machine is cobalt machine, which is based on cobalt 60. But now we prefer another machine, which I will explain later on, which is called as LINAC. This cobalt 60 has a half-life of 5.2 years. Okay, I'm repeating now. Only three things you need to know. Cobalt 60 half-life 5.2 years. Produces gamma rays, high energy gamma rays, used in teletherapy. And any other machine do we use in teletherapy? We use LINAC. What is preferred? LINAC. Okay, what is preferred? Prefer LINAC nowadays. Okay. New hospitals for teletherapy are putting a machine called as LINAC, which I will explain when I reach there. I'll explain what this machine is all about. Everybody understands this? Are you clear with cobalt? Okay. So let's go forward. Any other place where cobalt is used? Cobalt is also used in a machine called as gamma knife. Has any one of you heard about gamma knife? What is gamma knife? Have you heard of this gamma knife? Gamma knife is also called as bloodless neurosurgery. Or I can use the word stereotactic radiosurgery of the brain. Okay, what is gamma knife? Stereotactic radiosurgery of the brain. So what exactly it is, how it is using cobalt, I will explain to you. What is gamma knife? It is stereotactic radiosurgery of the brain or bloodless neurosurgery. What does this mean? Well, it is used for some indications in the brain. I will explain to you. First, let us see what are indications of using gamma knife machine. Indications are vestibular schwannoma. It is used in treatment of small vestibular schwannomas. Do you remember schwannoma, vestibular schwannoma that we discussed, ice cream cone appearance वाला जो हमने देखा था MRI में, vestibular schwannoma. It is also used for pituitary adenomas, meningioma, arteriovenous malformation, AVM, trigeminal neuralgia. If the patient is not responding to carbamazepine, you can use gamma knife, trigeminal neuralgia. It can also be used for glomus tumor in the skull base, and if you have metastasis to the brain, not more than 10. If you have less than 10 metastatic lesion, you can use gamma knife. Okay, I'm repeating everybody. What are indications of using gamma knife? Indications of using gamma knife are, anybody answer? Vestibular schwannoma, pituitary adenoma, meningioma, arteriovenous malformation, trigeminal neuralgia, glomus tumor, metastasis but not more than 10. मनोज कुमार, लिनैक गामा रेज नहीं बनाएगा, वो मैं बाद में बताऊंगा कि वो क्या बनाएगा, ठीक है? डोंट रश. ओके, व्हाट इज AVM? Some bachas are saying what is AVM. I will explain what is AVM also. Don't worry, I will explain. AVM is arteriovenous malformation. Arteriovenous malformation in the brain can be treated with gamma knife. Arteriovenous malformation. Okay, now my question to you are these. Let's see how many of you are able to answer. What is gamma knife actually? What we do in gamma knife is, if suppose this is a patient with vestibular schwannoma, suppose this patient has a vestibular schwannoma, you put a frame around his head. You put a stereotactic means it has markings on it. stereotactic frame on his head. This frame is called as Lexell's. I'm explaining what is stereotactic matlab. Shubham suno. This is called as Lexell's frame after the inventor. This is called as Lexell's frame. Okay. So what exactly is this? Okay. What exactly is gamma knife? Oh, try to understand. Okay. It is you. Some बच्चे saying कौन करता है सर्जन की रेडियोलॉजी. ये सब बच्चे आप लोग सोचते हैं असली में it is a team work. Radiologist is also there and neurosurgeon is also there. So you put a frame around the head of the patient. Okay. This frame is called as Lexell's frame. This is the name of the inventor, or stereotactic frame. After putting the frame, I am explaining what is stereotactic. Listen to me. After putting the frame, we do the MRI of the patient. Okay. Now, when we do MRI of the patient, this is the brain of the patient. This is the tumor. On MRI, you will be able to see the coordinates around the head. Okay. The coordinates of the frame can be seen around the head. Now, with respect to these coordinates, we can calculate the X, Y, Z coordinates of the tumor. With respect to the frame, you can calculate the X, Y, Z coordinates of the tumor. This is called as stereotaxy. Stereo matlab hota hai space. Taxi means localization. You are localizing the tumor where it is present exactly with respect to the frame that you have put. This is called as stereotaxy. Okay. Everybody understands? Okay. Now tell me. After this, we take the patient to the gamma knife machine. Now, this is how a gamma knife machine looks like. This is how the gamma knife machine looks like. Okay. This gamma knife machine has multiple cobalt source inside. It has multiple sources of cobalt 60 inside. Okay. Now you take the patient who has a frame on his head and you put the patient into this machine. Now the patient is inside this machine. Now using computers, we will focus the gamma rays produced by these cobalt sources onto the location of the tumor. Okay. This is called as gamma knife therapy. I hope you could get it. I'm repeating for all of you who could not, who were not at that time following it. So I'm repeating it for you again. Dekho, समझने को sure you will like it. Actually, it's very interesting that you are able to know about a machine which is being used for brain tumors like vestibuloschwannoma. You put a frame around his head, that is the Lexell's frame. Then you do a MRI. So when you do a MRI with a frame on his head, you get to see the tumor as well as the coordinates around his head. Now we use these coordinates to calculate the location of the tumor. Which XYZ coordinates have the tumor? Now you take the patient into the gamma knife machine which has multiple cobalt sources, and now you put the patient in the machine and you target the gamma rays onto those points where the tumor is located. So you are giving focused radiation onto the tumor only. This is called as gamma knife. Okay. Shweta is saying XYZ बच्चे coordinates होते हैं, X coordinate, Y coordinate, Z coordinate. Remember? Shweta, okay, clear? Everybody understands? Okay. So this is called as gamma knife. But the most important questions are: gamma knife uses cobalt. It is used in brain. It is stereotactic radiosurgery in brain. Indications are these: vestibuloschwannoma, pituitary adenoma, meningioma, AV malformation, trigeminal neuralgia, glomus tumor, metastasis, but not more than 10 should be there to use gamma knife. Okay. Okay, everybody gets it now. So my question is this, beta. My question is this. Let's see how many of you can answer. Some bachas were getting confused, sir. AVM kya hota hai? Let me explain. Suppose this is an artery. In a normal person, artery will divide into, tell me, arterioles. The arterioles will divide into a capillary network. Capillaries will join to form venules, which will join to form veins. Okay, everybody. Okay, Shweta कह रही है सर कोऑर्डिनेट से फायदा बेटा रेडिएशन वी हैव फोकस रेडिएशन ऑन दोज पॉइंट्स ना gamma knife means that you are not giving radiation to the entire brain, you are focusing your radiation beam only onto the tumor. That is what gamma knife means. Okay, now tell me beta, so this is normal artery capillary veins, this is how the normal is. Now my question to you is this beta, anybody, suppose you have a problem, a malformation where artery is connected to a bunch of vessels called as nidus, an abnormal bunch of vessels which are connected to veins. What is this? Okay, an arterial feeder, nidus, a bunch of vessels and veins, no capillary network, no capillary network. Then anybody explain to me? Then it is called as AV malformation. AV malformation. Okay. ओके अजेंद्र कह रहे सर कोऑर्डिनेट से पॉइंट मिलेंगे ना, अरे बहुत ज्यादा पॉइंट मिल जाएंगे ना, किस पॉइंट से किस पॉइंट तक ट्यूमर है बेटा हमें पूरा मिल जाएगा. ओके एंड इट इज यूज फॉर ब्रेन. गामा नाइफ एज अ मशीन इज ओनली फॉर द ब्रेन बिकॉज द फ्रेम हैज बीन इन्वेंटेड फॉर ब्रेन. Okay, everybody clear now? Now, okay. Now everybody tell me, this is what is AV malformation. Now, what is the problem with AV malformation? The problem with AV malformation is there is no capillary network. There is no capillaries. So, the high pressure arterial blood is going into the veins and these veins can rupture. It is one of the causes of brain hemorrhage. It can cause brain hemorrhage. Everybody understands? Okay. Okay. Now tell me, everybody tell me, I will explain other body parts also, but first focus on what I am teaching. So it can cause a brain hemorrhage in a young person, that is AVA malformation. So what is the treatment? If it is superficially located, you can do a surgical removal. Okay, surgical excision of the AVM. But if it is deep seated, if the AVM is deep seated in the brain, or if it is in a eloquent area in the brain, or that means a part in the brain where there is some significant function, you don't want to do surgery there, those are the kind, or if it is very large in size, you might want to go for gamma knife. What will you do? You will focus the gamma beam on the nidus, and because of the gamma rays, the nidus will get damaged, endothelial damage, and it will get thrombosed because of the gamma radiation damaging the endothelium, causing thrombosis. Okay, so this staging, which tells us whether to go for surgical excision of AVM or go for gamma knife in AVM in brain, is called as Spelzer-Martin grading of cerebral AVMs. Okay, Spelzer-Martin grading of cerebral AVM. Okay, everybody clear? Eloquent means a part of the brain which has some vital function, just a speech area, motor area. If you have a AVM in the speech area, then you will not do surgical excision of that area. You just have to do something very precise. And those are the kind of indications where you will do a gamma knife for AVM instead of going for surgery. Okay. So what grading of cerebral AVM helps you to define management? Spelzer-Martin grading. This is the concept behind AVM. Okay. This grading helps you to give some score to the AVM so that you can see the viability of whether we can go for surgery or we need to go for gamma knife. Okay, everybody clear? Okay, now let's go further. And I will talk about that. Can we use this gamma knife like thing for other body parts or not? We'll talk about all that. Just give me just 1 second to explain trigeminal neuralgia also. Suppose this is pons. From pons, a nerve is coming like this, going anteriorly towards the cavernous sinus, like this. This is your cerebellum. Okay. This is your trigeminal nerve. Okay. Just to give you an idea how gamma knife helps us, please see and understand. I see some bacha is again getting confused. Trigeminal neuralgia, shooting pain along the trigeminal distribution. Anterior to the pons, you have the basilar artery, and basilar artery is giving rise to some pontine branches. Sometimes one of those artery might be tortuous. One of those branch might be tortuous, and it can form a loop around the trigeminal root. Now anybody can tell me, beta, एक बार मुझे बताना, एक बार सोच के बताना है ना. If you have a vascular loop around the trigeminal nerve, what will happen? It will pulsate, and when it pulsates, what will happen? The nerve will stimulate, and you will have shooting pain along the trigeminal distribution. So trigeminal neuralgia is happening because of a vascular loop along the trigeminal nerve. Treatment, carbamazepine. But now if the patient is not responding to carbamazepine, we can give radiation with gamma knife precisely on this point where the nerve root is entering the pons. At this point we can give some radiation to the root, nerve root, low dose radiation to damage the pain sensation there. Okay. Okay, everybody gets it? Clear? Okay. Now in AVM we are only damaging that nidus with gamma rays. We are not damaging the entire vasculature. Anmol Tyagi. And I think one bacha is saying, Sudhan, how is cobalt used in gamma knife? But a gamma knife you need to produce gamma rays. So you need a source. That source is cobalt. Cobalt is the source of gamma rays in gamma knife. Okay. And you can do surgery also to do a microvascular decompression of the trigeminal nerve. Correct, Kamran. Okay, everybody clear? Okay. Now, my question to you is this. So once you have understood all this, I'll also give you an idea that some bachas are asking, so I'm covering this here. We can also use cyber knife. Cyber knife is a new update. Cyber knife, instead of using cobalt, uses linac. Which produces X-rays. And instead of using a Lexell's frame, uses a computer generated, or you can say a virtual frame around the body. Okay. Okay, I'm just explaining something to you which is slightly on a more tougher level, but because some of you were asking this, I'm answering you. Now there is a new machine available called as cyber knife. Anybody tell me what is cyber knife? Tell me. Cyber knife is based on linac. Linac is the source of X-rays. So cyber knife does not use cobalt, and it does not use Lexell's frame. It uses virtual frame. Now the value here is this virtual frame can be made anywhere in the body. So it can be used for whole body. Any tumor in the body can be, you can use a radiation with cyber knife. It uses X-rays, not gamma rays. No isotope is required. So it is more cost effective. No isotope is required. No frame, no physical frame is required. Okay, beta. So are you clear? Some of you were asking that, sir, can we not create a gamma knife like machine? It is already created. So they were not waiting for you. They've already created. This is called a cyber knife. Cyber knife is a machine which is using linear accelerators, linac, to produce X-rays. So it uses virtual frames, computer generated frames. So there is no physical frame, whole body. It is not restricted to brain. can be used for it. No isotope is required. Clear? So what is LINAC? LINAC is also a particle accelerator. I will explain, but it is linear. Cyclotron was accelerating in circles. Here it will accelerate in straight line, linear accelerator. Diksha is saying, so what is virtual frame? Virtual मतलब computer generated frame. असली का frame नहीं है. Virtual मतलब नकली है वो सब. Virtual means computer generated frame. Okay, beta? Okay. So this is the difference here. Now let's go forward now because we have to go forward also. Now, what is difference between teletherapy and brachytherapy? Brachytherapy means that if you keep an isotope in contact with the tumor or in the tumor cavity or inside the tumor substance. Suppose you keep the isotope in contact with the tumor or in the cavity or in the substance. Okay, then we call it brachytherapy. Teletherapy था, away रखा था. So one bacha is saying, sir, why bloodless? Because we are not doing, actually surgery is not being done. We are using radiation to do surgery. So radiation is acting like a knife. No skull is not opened, no craniotomy is done. So it is bloodless. Okay. Okay. Okay now. And yes, actually nowadays the modern hospitals are buying cyber knife more than gamma knife because it has more indications, more cost effective. Correct. I think you can become an entrepreneur. You have picked up the good point. Now tell me, what is definition of brachytherapy? Radioactive isotope should be in contact, cavity or substance. If in cavity, we call it intracavitatory therapy. If in tumor substance का मतलब कि आप ट्यूमर के अंदर निडल डाल रहे हैं. You're putting needles inside the tumor. So that is called as interstitial radiotherapy. Okay. Here tumor substance समझाए त्रिशा. Tumor substance means you are putting the needle into the tumor, inserting it inside the tumor. Like suppose somebody has cancer prostate. So you are putting the needles into the prostate parenchyma. That is interstitial brachytherapy. Okay. All three of them are methods of brachytherapy: contact, cavity, substance. Everybody understands? What is the advantage? Advantage of brachytherapy is if you put the isotope directly in contact with the tumor. If the isotope is put directly in contact with the tumor, the advantage is that you can give very high dose to the tumor as compared to surrounding tissue. So try to understand better. I will explain. If I am giving radiation from outside, I don't want my normal tissue to get damaged. So that is a limitation. But if I am putting the isotope directly into the tumor, now I can give very high dose to the tumor as compared to surrounding tissue. कौन बच्चा कह रहा है कैविटी का क्या मतलब है? देखो सी ए सर्विक्स में if you put a isotope into the cervical cavity, C endometrium cavity, so that is also brachytherapy. Okay, everybody understand? Mudita, are you clear beta? C A cervix में और C endometrium में you will hear about intracavitatory brachytherapy. Okay, so what is the advantage? Anybody, what is the advantage? High dose to the tumor as compared to surrounding tissue. Disadvantage or limitation, can be used only in easily accessible tumors. ट्यूमर तक हम आइसोटोप पहुंचा पाएंगे तभी यूज कर पाएंगे. Easily accessible tumors like head and neck tumor, anything else, anything you can think of? Gynecological, CA cervix, CA endometrium, prostate, esophagus, even in breast there is a role of brachytherapy. So brachytherapy is used to, you have to put the isotope in contact with the tumor. So it can be used if the tumor is easily accessible. Now question number 1, what is the, anybody tell me, what is the most important isotope used in brachytherapy? What is the most important isotope used in brachytherapy? कृतिका शर्मा is saying, सर आज रक्षाबंधन है, जल्दी जाने देते हैं. बेटा वो सुबह था, अभी नहीं है. Okay, anybody? So the most important isotope for brachytherapy is iridium 192. Iridium 192. Okay, clear? Iridium 192. Everybody tell me, what is the half-life of iridium 192? 74 days. 74 days. Used as a temporary implant. It is small in size. The isotope has a very small size. It easily fits into the tubes. I will show you the tubes. And it produces high dose rate radiotherapy. It is high dose rate, in short form is written as HDR, which is more than 12 gray radiation per hour. Okay, quickly tell me 4 points about iridium 192 that you need to know. 4 points are: half-life 74 days, used as temporary implant. Temporary means you put it into the tumor, and after that, after therapy you take it out. Permanent implant mean you put it into the tumor, leave it there. Permanent implants are when you put the isotope into the tumor and leave it there. Okay, it has small size. It is used for high dose rate brachytherapy. High dose rate is more than 12 gray per hour. Other than iridium 192, we can also use cesium 137, which has a half-life of 30 years. But the preferred is iridium 192. Okay, it is used in head. Okay, let me show you the last slide again for the children who missed it. So it can be used for head and neck tumors, CA cervix, CA endometrium, prostate malignancy, esophageal malignancy, breast cancer. Okay, rate means how much radiation per hour. So more than 12 gray per hour is high dose rate. Okay, beta, Shweta. Okay, so this was brachytherapy and iridium and cesium. Now automatic question comes. Automatic comes into your mind that if we are giving high dose rate radiation, so who is going to insert the radioactive isotope into the tumor? Tell me. Anybody tell me? I am explaining to you, but listen to me first. Suppose you are putting the isotope into the tumor of the patient. If it is high dose isotope, you will also get radiation. The doctor will also get radiation. So nowadays, to put the isotope in high dose brachytherapy, we use remote afterloaders. What do we use? We use remote afterloaders. I will explain to you. Suppose this is the tumor. Okay, this is the tumor. What we do is, you as a doctor will apply some empty applicators. You will apply some empty applicators onto the tumor. These are empty, hollow applicators, nothing inside them. These applicators are connected to tubes. These tubes are connected to a machine called as remote afterloader, and the doctor is standing here. Now, important thing to understand is, doctor will come out, he is not handling the isotope, he is only switching on the remote afterloader. When the remote afterloader is switched on, the isotope will travel from the tubes into the applicators. That is why the small size of iridium is desirable. Because iridium can fit into these tubes easily. Okay, everybody understands? So Megha, half-life of cesium was 30 years. I think everybody else is telling you in the chat box. Okay, anybody now tell me, are you able to understand this? So in which kind of radiotherapy remote afterloaders are used? Answer is brachytherapy. Remote afterloaders are used in brachytherapy so that we can use high dose rate isotopes and save the doctor. So the role is to prevent radiation to medical personnel. Clear? So brachytherapy machines, now for giving brachytherapy, for especially for isotopes like iridium, which are high dose rate, we use remote afterloaders. Remote afterloaders mean that the doctor will apply on the tumor hollow applicators only, so that doctor is telling where the radiation is to be given, you are inserting, then the doctor comes out and he switch on the machine, and the isotope from the machine goes into those applicators via these tubes. This is called as remote afterloader. Are you clear, beta? Yes, Shweta Jaiswal, correct. That this small size was desirable to, so that it can fit into these tubes easily. Okay, okay, Vaishnavi and Samuel, now you are clear. Remote afterloaders are machines used to help the doctors to prevent getting radiation in this. Clear? Okay, let's go forward. So, what else? Can we have low dose rate radiotherapy also? Can we have low dose rate brachytherapy? In the exam, they will say LDR. Okay. In the exam, they will say LDR. LDR is defined as 0.4 to 2 gray. GY is gray. Okay, I'm writing it. I will explain also. Don't worry, I will explain units also. Okay, LDR brachytherapy is 0.4 to 2 gray per hour. The examples are palladium, iodine 125. Any example, any idea now? Now, because these are low dose rate isotopes, they can be used as permanent implants. They can be used as permanent implants. You don't need to take them out. You leave them in the tumor itself. Okay. Second question. We can also use radioactive gold implants. Anybody? Radioactive gold implants in the peritoneum. Radioactive gold implants can be used in peritoneum to treat malignant ascites. Suppose you have ascites because of cancer in the peritoneum, you can put gold implants in the peritoneum, which is radioactive gold implants are used for treatment of malignant ascites. Okay. So which are the isotopes here? Palladium, iodine 125, radioactive gold. Radioactive gold implants, or these are gold seeds that we use in this treatment. Everybody follows? Okay. Now let's go further and let's make it more interesting. We need to also see the, okay, because you have asked a question, let me just pull up the slide here. Let us also do the radiation units here itself, because some of you are getting confused between the gray and what is gray, etc. So how do we measure the radiation? There are units defined. So first you will make a table, you will write definition. I am telling gray beta, don't worry, I am telling gray beta, don't worry. Common unit, SI unit, SI unit. Okay. गोकू तिवारी वी सेड कि अगर किसी को कैंसर पेरिटोनियम में फैल जाए तो उसे असाइटिस होगा कैंसर के कारण, जिसको पैलिएटिव ट्रीटमेंट के लिए आप पेरिटोनियम में गोल्ड रेडियोएक्टिव गोल्ड सीड्स लगा देते हैं. ओके बेटा, आई होप दिस हेल्प्स यू. ओके, एंड यस, नाउ सी एवरीबडी, रेडिएशन यूनिट्स. व्हाट इज द यूनिट ऑफ total radiation exposure received by the patient? Total radiation exposure. What is the unit of total radiation exposure? Okay, total radiation exposure is measured in, anybody? Roentgen. Common unit of measuring total radiation exposure is Roentgen. What is the SI unit? SI unit which is now used is Coulomb per kg. C per kilogram. Everybody, can you remember this? So if they ask you in the exam, they will ask you SI unit. Old units they will not ask, they will ask you SI unit. But you will get confused, that is why I am making the full table. Total radiation exposure is measured in Röntgen, but now the SI unit is coulomb per kilogram. Coulomb per kilogram. Okay. Now second question. Everybody, please see with me. Second question. Let me make it for you. Out of the total radiation, how much is absorbed by the skin of the patient? How much radiation is absorbed by the patient is measured in a unit called as rad. Rad में A मतलब absorbed. Okay. How much radiation is absorbed by the patient is measured in rad. But rad is, remember, rad is not the SI unit. SI unit for absorbed dose now is gray. Okay. How much is a gray? 1 gray is equal to 100 rad. अभी आप पूछ रहे थे ना GY क्या होता है? ग्रे. Okay. 1 gray is equal to 100 rad and it is equal to 1 joule per kilogram. Okay. It is equivalent to joule per kg energy deposit. Now out of the absorbed radiation, the question is how much is biologically effective? So how will you measure the biologic effectiveness or biological equivalent of radiation? So to measure the biological equivalent, we use a unit called as REM. REM में E मतलब है equivalent. So this is telling you how much of the radiation that the skin has absorbed is biologically harming the patient. So that is measured in REM. SI unit here is sievert, which is written as SV. 1 sievert is equal to 100 REM. Okay, I am again repeating. This is the table that I am just removing myself so that you can see clearly. देखो ये यूनिट्स हैं, आपने सुना भी होगा रॉन्जन रैड रैम. जस्ट एक बार समझ लेते हैं. एक बार समझ लो, पेपर में आएगा तो बोनस है, देख लो. टोटल रेडिएशन एक्सपोजर इज मेजर्ड इन रॉन्जन. SI यूनिट विच इज द स्टैंडर्ड यूनिट कूलम पर kg. एब्जॉर्ब डोज रैड. स्टैंडर्ड यूनिट ग्रे. ग्रे कितना होता है? 100 रेड्स के बराबर and it is same as 1 joule per kg. Biological effectiveness or biological equivalent is measured in REM. Biological effect is measured in REM. E for equivalent है यहाँ पे and SI unit is sievert. 1 sievert is 100 REM. Okay. Now it is important that because these are very very common words that have been used in literature, so it is good to know both of them. And how do we measure radioactivity? How do we measure radioactivity? I will tell you. To measure radioactivity, the older or the common unit is Curie. The standard unit for SI unit for radioactivity is becquerel. After the scientists, these are the names given. The common unit for radioactivity is Curie. The SI unit is becquerel. 1 Curie is 1 gram radium disintegrating per second. It is equivalent to 3.7 into 10 to the power 10 disintegrations per second. 1 becquerel is equal to 1 disintegration per second. D मतलब disintegration. Radioactive चीज ना disintegrate करती है. Okay, I am again repeating beta. So these are only small one-liners, and I hope you are able to see that these are very important one-liner which can come into the exam. So just stick to the class notes, nothing else. So radioactivity, SI unit of measuring radioactivity is becquerel, which is 1 disintegration per second. Older unit is Curie, which is 3.7 into 10 to the power 10 disintegrations per second. क्यूरी इज एक्चुअली 1 ग्राम रेडियम 1 सेकेंड में कितना डिसइंटीग्रेट करता है. ओके, क्यूरी इज how much disintegrations are seen in 1 gram radium in 1 second. Okay, everybody follows? Okay, so you might get a question on unit. It is a simple one-liner. So let us also now, we have seen alpha rays, beta rays, gamma rays. I will also show you X-rays. To see X-rays, let us first of all see the man who discovered it. The man who discovered X-rays was this guy. Okay, so who is he? Father of X-rays. We have not seen any father in radiology, so let's see at least father of X-rays. The man who discovered X-rays was W.C. Röntgen. Now this is the change that has happened in India. Earlier, like if 1990s or early 2000, they could ask this question, but now they are not asking scientists. Sometimes one or two questions come, but mostly this is not encouraged. Okay, this is father of X-rays, W.C. Röntgen. W.C. Röntgen. Okay, anybody? So एक बच्चा कह रहा है is this chapter important? So when you will see all the pages, it will be hardly, I think, 5-6 pages of notes, not more than that you have made. And I have covered everything, but in very, very concise and crisp manner. Röntgen discovered X-rays on 8th November 1895. He was a German, for which he got Nobel Prize in the year. He got Nobel Prize in the year 1901. His Nobel Prize was for physics. He was the first Nobel laureate in physics. And the International Day of Radiology every year is celebrated on 8th November. Radiology Day is on 8th November. And the first human X-ray is this. This is first human X-ray. This is the hand of his wife. And wife was Anna Bertha. Why is she famous? Because she is the first human X-ray. Her hand is there. You can see the wedding ring also. Okay, so a little bit about how the science of radiology started. It started in 1895 when Röntgen discovered X-rays. Okay, clear? Let's now, if you get the hang of it, and I think one bacha's Gauravi Bhatt has a birthday on the radiology day, so maybe she might take up radiology later on. So let's try to understand what is happening just for fun. Just for fun, I'll tell you what is happening in the history. 1895, a man sitting in Germany, Röntgen, discovers X-rays. Okay, 1895, Röntgen discovered X-rays sitting in Germany. 1896, another Frenchman, Henry Becquerel, he discovered radioactivity. Okay, this is not for exam. I'm just telling you, why it is so interesting to know how things have evolved. 1895 Röntgen ने X-ray ढूंढे. 1896 में Henry Becquerel फ्रांस में बैठा था, उसने रेडियोएक्टिविटी को डिस्कवर किया. Okay, everybody listen to me, beta, listen to me. Now what will happen? Now suddenly people started to study the properties of these waves. People started to study property of X-ray waves, different particles. And by 1900, it was clear to everybody that at the atomic level, the classic Newtonian principles of physics do not apply. Are you able to remember? कि उसके बाद ना 1900 में जाके लोगों को पता चल गया कि atomic level पे physics एकदम अलग है. And that was the beginning of the year of quantum physics. And there were scientists like Max Planck, Rutherford. I don't know if you have heard of them or not. So there were people like Max Planck who were at that time champions of quantum physics. और साथ में एक आदमी था जिसका नाम था एल्फ्रेड नोबल. एल्फ्रेड नोबल ने ना उधर डायनामाइट डिस्कवर किया. अभी रिपीट मत कराना, कहानी एमसीक्यू नहीं है, मैं नहीं करूंगा. है सो एल्फ्रेड नोबल जो था ना, उसने डायनामाइट डिस्कवर किया. And by that time, he was growing old. He had made so much money selling dynamite, and he was called as Dynamite Man. Okay, because he was selling dynamite. He was the man behind dynamite. अब उसको लगा अपनी इमेज बदलनी है. So 1900 में उसने डिसाइड किया कि एक अवार्ड शुरू करते हैं मेरे नाम के बाद जो साइंटिस्ट को दिया जाएगा. सो 1901 में उन्होंने सोचा किसको दे फिजिक्स का नोबेल प्राइज, किसको दे फिजिक्स का नोबेल प्राइज, एंड दे डिसाइडेड टू गिव इट टू रॉन्जन बिकॉज हिज डिस्कवरी हैज सेट द बॉल रोलिंग फॉर क्वांटम फिजिक्स. अगर रॉन्जन एक्सरे नहीं डिस्कवर करता तो क्वांटम फिजिक्स ही नहीं आ पाता. इंटरेस्टिंग. Okay, so Ranjan got Nobel Prize for Physics. By the time people were also joking about that it can also be used in biology, that X-rays can be used in biology and medicine, but people were not sure. आगे बढ़ते के 1913 1914 आ गया, यहाँ पे हो गया वर्ल्ड वॉर. वर्ल्ड वॉर में सोल्जर्स को गोलियां लग रही थी एंड वी नीडेड अ मशीन विच कुड सी दी बुलेट्स, कहाँ गई बुलेट, निकालने कैसे. सो पीपल स्टार्टेड मैन्युफैक्चरिंग X-ray machines in bulk, and then they started to realize the true value of X-rays. And Ranjan never patented X-rays, so उसने उसमें से कुछ भी नहीं कमाया. He died a poor man. Okay, interesting story. So history is very interesting, but sometimes बच्चे पसंद नहीं करते, so we don't go into them. It's okay. It's very interesting to know all this, but how we have actually reached to the point where we are right now. Okay. And I think Dr. Deepthi has arrived. So I will request Dr. Deepthi, if she is listening to us today, I am requesting her that at the end of my class, if she can also be a part of today, and if she can, speak something to the students at the end. Okay. Now let's go further. Okay. So what are X-rays and what is it that the Ranjan had discovered? X-rays are electromagnetic waves. X-rays are electromagnetic waves. We can call them as we can define them as high energy, high frequency electromagnetic waves. So if anybody asks you what are X-rays, what will you mark? High energy, high frequency electromagnetic waves. Okay? High energy, high frequency electromagnetic waves. What is the velocity of X-rays? X-rays have a velocity of 3 into 10 to the power 8 meter per second, same as that of light. Clear? X-rays have a velocity of 3 into 10 to the power 8 meter per second, which is same as that of light. X-rays are extra nuclear in origin. They are not produced by any isotope. They are not produced by radioisotopes. They have a wavelength of 0.121 Armstrong. X-rays have a wavelength of 0.121 Armstrong. Okay ji, everybody clear? So these are some properties of X-rays. X-rays are unique waves which can penetrate the human body. They can penetrate the human body and help us to see inside the human body. This was the beginning of an era. So far we could not see into the body. Now X-rays could do this in 1895. Very interesting. Now see, X-rays are electromagnetic waves, high energy, high frequency, velocity same as that of light, extra nuclear, not produced by isotope, wavelength 0.121 Armstrong, penetrate human body. And also remember, Armstrong is 10 to the power minus 10 of a meter. Armstrong is 10 to the power minus 10 of a meter. Okay? Everybody clear? So these are properties of X-rays. How are they produced? How are X-rays produced? I will explain. X-rays are produced by a tube. This is called as X-ray tube. X-ray tube has a, चलो भैया रेडियोलॉजी में वापस आ जाए सारे. Okay, my question is, X-ray tube has two parts. It has one part called as cathode, other part called as anode. Okay, X-rays have two parts. One part called as cathode, another called as anode. Okay, cathode has a wire in it which is called as tungsten filament. Cathode has a wire inside it which is called as tungsten filament. Okay, Now today we will not take the dinner break. We will finish it in continuity. It is small topic. Please, bear with me. है ना? Cathode has a tungsten filament which has a atomic number of 74, but the melting point is very high. It is more than 3000 degree Celsius. I will explain to you why am I telling you these physics. Just a small one-liner thing that you might have read about it in school also, but I want to make sure that I tell you myself. Cathode in a X-ray machine is made up of tungsten filament, atomic number 74, very high melting point. Okay, now please see with me. I will tell you, I will explain to you. Beta dekho mere saath. Suppose we pass current through a wire. All of you now focus on the class. Suppose you pass current through this wire. What will happen? If you pass current through a wire, the wire gets heated up. जब भी वायर में से करंट जाता है, वायर हीट अप हो जाती है. How much heat? What is the formula of heat? Anybody? What is the formula of heat? Anybody? I square RT. Do you remember from school? I square RT पढ़ा था ऐसा. Heat produced by a wire is square of current radiation. Remember I square RT. So we will, if you pass current through a wire, the wire will get heated up. When the wire gets heated up, the electrons are emitted out. Okay, and I can see many bachas, Dipjyoti, Subham, and everybody are answering the I square RT. अभी brain की anatomy पूछता तो नहीं याद रहती. Can you tell me why? Why even remotely learned things from school you still remember, but college you have forgotten? Because in school you were not asking if and but, you were studying. But when you come to college, you are starting to asking if and but. Sir, if I study, will this come in exam? Sir, but I am not tired. I am just, too much if and but. Total loss of spirit in the school. School, you were totally spirited. Teacher ने बोला पढ़ना है तो पढ़ना है. अब कॉलेज में आके, sir, if I study, will I get if but हो जा रहा है. Do you agree कि नहीं? So my question to you is, stop saying if and but, have faith and keep studying. Okay? Now tell me. When you pass current through the cathode, the wire gets heated up, the electrons are emitted out. This is called as thermoionic emission. This is called as thermoionic emission. Okay, thermoionic emission. Now tell me, अब ये इलेक्ट्रॉन गए इधर कैथोड के एनोड की तरफ. एनोड पे we have kept a target made up of tungsten plus 10% rhenium. 90% tungsten, 10% rhenium. On anode, we have kept a target which is 90% tungsten, 10% rhenium, and these electrons will come and strike the tungsten target. Now, tungsten is very hard object. When the electrons strike it, they stop. Everybody listen to me, beta. When the electrons strike the tungsten target, they stop. Because it is very hard, it stop. Okay. Now anybody tell me, what energy do these electrons have when they are moving? कोई भी चीज मूव कर रही है, कौन सी एनर्जी होगी उसमें? Anybody? If something is moving, it has mass and velocity, you will have kinetic energy. What is the formula of kinetic energy? Anybody tell me in the chat box. फॉर्मूला क्या है काइनेटिक एनर्जी का? एग्जाम में नहीं आएगा, पुराना पूछ रहा हूं. हाफ mv square. Remember, and I can see many of you are already telling me this. Why? Because स्कूल में if but नहीं कर रहे थे, पढ़ रहे थे, मजे लेके पढ़ रहे थे, पता था पढ़ने से करियर बनेगा. अभी भी पता है, लेकिन अब आप बड़े होने के बाद यू स्टार्ट आस्किंग, सर इफ आई स्टडी विल आई गेट बट. पूरी एनर्जी इफ बट ने खा ली है. डू यू एग्री कि नहीं? इफ एंड बट ने पूरी जिंदगी निकाल दी, जीतने नहीं दे रहा. सो भूल जाओ वो इफ एंड बट, दोबारा पढ़ना शुरू करते हैं. वही स्कूल वाला मोजो, वही स्कूल वाली स्पिरिट वापस लेके आनी है, जहां पे पता था टीचर बोल रहा है पढ़ना है तो पढ़ना है. एग्री कि नहीं? बोलो. यू आर इन इट टू विन इट. फॉरगेट अबाउट इफ एंड बट. यार बहुत हो गया इफ एंड बट. सारा दिन इफ. मैं अगर मेरा इनबॉक्स खोलता हूं ना, सारा दिन यही आता, सर इफ आई स्टडी विल आई गेट थ्रू. Sir, if I study, if I listen to you, it is important. Sir, but sir, my friends are saying, sir, but if but khatam. Okay, now tell me. My question to you is this: if the electrons which have kinetic energy they strike the target, what will happen? They will stop. No kinetic energy, but energy cannot be destroyed. This energy is converted into a new type of radiation called as X-rays. This kinetic energy is called as X-rays. Okay, so I'm repeating in English also that stop saying if and but and start studying. You will win just like you were doing in school. Okay, are you clear, everybody? How are X-rays produced? X-rays are produced when you apply a brake on fast moving electrons. X-rays are produced when you put a brake on fast moving electrons. This phenomena is called as, these kind of X-rays are called as Bremsstrahlung, which is a German word meaning brake X-rays. So X-rays that we use routinely, in routine X-ray machine are Bremsstrahlung X-rays. Bremsstrahlung is a German word which means brake लगाना, brake लगने से बनने वाले X-ray. Okay? Anybody? Bremsstrahlung X-rays, brake लगने के कारण बनने वाले X-rays. Okay? Okay. Everybody follows? Okay. Now, so far we have learned two things. We have seen how X-rays are produced, what is cathode, what is anode, what is target material, why we use the term Bremsstrahlung. And I've also explained to you why in school we were better learners than what we become in college, because in college you are asking too many guarantees. I keep seeing students who get guarantee hogi to padunga. I keep seeing, first year MBBS student, he is asking me question. He's just joining MBBS. Say, sir, do I need to buy books? I said, please do that. Sir, any benefit? Books are good. We should read books. Then, sir, should I read anatomy? Definitely you should. So you understand. So stop asking if and but. It is important that doctors should be well read. I made a video, I think yesterday, you might have seen it on YouTube, about how to become a good doctor, and reading is important. So stop if and but hatana padega. Do you agree? Okay, now let's go further. So second question is the X-ray machine same in mammography and X-ray machine? No. Mammography machine, the target material is molybdenum. In mammography, the target material is not tungsten, it is molybdenum. Okay. So what happens is, if this is a molybdenum target, and these are the electrons, So electrons, when they strike the molybdenum target in mammography machine, instead of stopping there, because molybdenum is softer than tungsten, they go into it and they strike the atom of molybdenum. These electrons, when they strike the atom of molybdenum, they strike the innermost electron. They hit the innermost electron which is present in the K shell and eject the innermost electron. As a result, the outer electrons have to come down to fill that gap, and then energy is released in form of X-rays, which are called as characteristic X-rays. मैं दोबारा बताऊंगा, don't worry, थोड़ा सा मुश्किल है. देखो. So what I'm trying to tell is, there are two mechanisms of producing X-rays. The one which is used in routine X-ray machines is Bremsstrahlung, where X-rays are produced by applying brake on the electrons. But second, which is used in mammography machine, is characteristic X-rays. These X-rays are produced when an electron from a L shell goes to a K shell. When an electron from an outer shell comes to a lower shell, characteristic X-rays are released. Only two things are what you need to remember. Mammography, the target is molybdenum, type of X-rays is characteristic. If you are finding the physics tough, forget about it. Just remember two lines. Target material in mammography, molybdenum, type of X-rays, characteristic. Okay? Everybody clear? Okay. Now let me take you further and let us try to understand. Now X-rays are produced. How do these X-rays interact with the atoms and our body? There are two interactions which we will only write down. We will not go into the physics of it. That is not required. Only two lines you need to remember. X-rays, when they strike the atom in our body, this is nucleus, these are the atoms. Two things are possible. If we are using low energy X-rays, which we use for diagnostic radiology, the X-ray beam strikes the atom, strikes the innermost shell, and electron is ejected out. Which electron? Innermost electron, which is at the K shell, is ejected out. As a result, the outer electrons come down and the extra energy is released in form of radiation, which strikes your X-ray film to form the image of bones and soft tissues. This effect is called as photoelectric effect. This effect is called as photoelectric effect. Okay, everybody answer these questions now. I am repeating for you. How does X-ray interact with matter? It interacts with photoelectric effect. Is seen with low energy X-rays in diagnostic radiology. It happens at the innermost K shell. However, if you use high energy X-rays, these X-rays strike the atom and they scatter from the outermost shell. This is called as Compton effect. This is called as Compton effect. And this is what is used in high energy X-rays, which is used in radiotherapy. Okay, now what I am trying to tell here is that you don't need to go into detail more than what I have written. I have written only two lines for you. In diagnostic X-rays, when we are trying to make a diagnosis, we are using low energy X-rays. Okay, Rohan and everybody, Robin, please listen to me. जब हमें बीमारी को डायग्नोस करना है, in diagnostic X-rays we are using low energy X-rays which are known to interact with the innermost shell or the K shell of our tissue, and when the K shell electron is ejected, the outer electrons come down, produce X-rays, they strike the film, they form the image of bones and soft tissue. This is called as photoelectric effect. So what is the interaction between matter and X-ray forming the images? Photoelectric effect. But if we use high energy X-rays, they interact with the outer shell of the atom and they get scattered from the outer shell. This is called as Compton effect. Compton effect is useful for radiotherapy. Okay, everybody clear? Okay, so I will just repeat it once for you so that everybody is able to answer this. See, whenever X-ray strike our human body or any matter, there are two effects happening: photoelectric effect, Compton effect. Photoelectric effect, Compton effect. Anybody? Which happens at low energy? Photoelectric effect. Which is seen at diagnostic X-rays level? Photoelectric effect. Which happens in the inner shell or the K shell? Photoelectric effect. Which happens at the high energy X-rays? Compton effect. Useful for therapy X-rays? Compton effect. Outer shell? Compton effect. Okay, बस इतना ही याद करना है आपने. Alap, it is not, you cannot explain it based on superficial physics. It is more deeper than that. So do not try to extrapolate. This is what it is. This is what you need to know. These are the only 3 lines that you need to know. Okay. Sindhu is saying dinner bremstla. So today we are on the, we have a bit time. I'll try to finish. Don't worry. I'm on target to finish it on time. Don't worry. Okay. So what else? Whenever we are doing X-rays, you might have seen that people who are doing the X-rays, they wear a lead apron. Anybody? Anybody can tell me? When we wear a lead apron, we are trying to protect ourselves from the scattered radiation. So what is the recommended thickness of lead? 0.5 millimeter thick is the recommendation. So sometimes they will ask you as a question, what is the recommended thickness of lead in lead aprons? Answer is 0.5 millimeter thick. Second question is, how do you do personal radiation dose monitoring? How do you do personal radiation dose monitoring? That means the doctor who is working with radiation, how to monitor his radiation exposure? We use a batch called as TLD batch. And some of you might have seen this particular question in a previous NEET exam. Radiation dose monitoring in doctors, in workers is done with TLD batch. What is TLD batch? Thermoluminescent dosimetry. So you might have seen that the doctors who are working with radiation, they will wear a badge when they are in the department, so that if they get any accidental radiation exposure, that is recorded. Okay, so that if they get too much radiation, they can be sent on a leave also. TLD batch. TLD batch is thermoluminescent dosimetry, used to measure personal radiation dose. Now I see some bachas are asking, what is the maximum permissible radiation dose? Now maximum permissible radiation dose is different for different groups. I will write it down. You can write it with me. Very important question. Sometimes it is asked also. For general public, maximum permissible radiation dose is 1 millisievert per annum. Okay, happy? I see one bacha was repeatedly copying and pasting this question. What is the maximum permissible radiation dose? 1 millisievert per annum for general public. Immediately the second question will be, anybody? What about occupational exposure? People who are working with radiation, what is the upper limit for them? And this is asked as a question. What is the maximum permissible radiation dose for occupational exposure? Anybody? Occupational exposure की maximum permissible dose है 20 millisievert per annum. Occupational exposure, it is 20 millisieverts per annum. Pregnant lady. For pregnant lady, in general public, there is no guideline, because in general public, pregnant lady should not undergo X-ray. But if a pregnant lady is occupationally exposed, that means she is a radiation worker, then there is an upper limit. She should not receive more than 1 millisievert for the declared term. मतलब जब से उसने अपने डिपार्टमेंट में बताया कि वो प्रेग्नेंट है, उसके बाद से. I am repeating for all of you. Maximum permissible radiation dose for general public is 1 millisievert per annum. Occupational exposure 20 millisievert per annum. Pregnant lady, that means a radiation worker who is pregnant, as soon as she informs the department, for that period, for after that, the declared term period, she should not get more than 1 millisievert. This is the upper limit. Okay. Now Trisha and Gayatri saying alag kyun hai? See beta, an occupational exposed person is more likely to get some radiation and more likely to ask compensation from the lawyers, using lawyer from the department. So that is why occupational limit has been kept a little higher, so that the court cases are lower. Okay, clear? Okay. So general public is less likely to seek compensation. Radiation workers are more likely to seek compensation. So they have kept the limit only high so that the court cases are not there. Okay. And second thing is, usually for radiologists there is almost no exposure, because usually we do the reporting part. The technicians are the people who are usually exposed more than the doctors. Okay. Everybody clear? Okay. Let's take more concepts. So let's make some small quick concepts. What is X-ray film? X-ray film, in conventional X-rays, only two lines we need to know about it, is a double coated film which is made up of silver bromide and silver iodide. In mammography, the films are single coated. I will explain to you, don't worry. Now double coated means that the silver bromide and iodide is present on both sides of the film. Both sides of the film are photosensitive, that is double coated. In mammography, only one side the photosensitive emulsion is applied. So sometimes they ask you a question. Mammography is single coated film, X-rays are double coated. In digital X-ray films, nowadays we do digital X-rays. So digital X-ray films, we do not use silver. Silver films are not used. Now what we use are plastic films only, so they don't have silver in it. Don't get confused. This is conventional. The older times, the blue X-ray films that you see sometimes in government hospitals are silver bromide and silver iodide. Routine X-ray double coated, mammography single coated, digital X-rays do not use silver. Dark room in the radiology department is actually not dark. It has red light illumination, which is called as safe light. Why? Why? Because let me explain to you, because X-ray films are more sensitive to blue spectrum of the light, least sensitive to red light. Okay. So in the dark room, the technician is developing the X-ray films. तो अगर X-ray develop करते समय light लग गई तो film खराब हो जाएगी. So when we are developing the X-rays, if at that time the X-ray film is exposed to light, the film will get spoiled. But red light is safe, because red light does not damage the X-rays, it does not expose the X-rays, because X-ray film स्पेक्ट्रम के ब्लू की तरफ ज्यादा सेंसिटिव है रेड के मुकाबले. इफ यू रिमेंबर दी विबग्योर. ओके, एवरीबडी क्लियर? ओके, व्हाट अबाउट फीटस? Very quick, some very important points I am giving you, small points. I think we should be able to finish by next 15-20 minutes, maximum 15-20 minutes. Listen to me. What is the about fetus? Fetus, we need to remember two lines. Fetus is most radiosensitive. Fetus is most radiosensitive between 8 to 15 weeks. And teratogenic effect is seen after 5 rad exposure. Okay, can we mark two questions? Easy. Fetus is most radiosensitive between 8 to 15 weeks. Teratogenic effect is seen after 5 rad exposure. Okay, let me show you the previous slide also. What color light is safe in radiology? Red light is safe in radiology. Okay, in which investigation we use single coated film? Mammography. Double coated film? Conventional X-rays. Do digital X-rays films are made up of silver? No, they are plastic films. Okay, Okay. Some questions about cell cycle. This is very important, and you saw this, I think, last to last year in the AIM INI-CET exam. Which phase of the cell cycle is most sensitive to radiation? Which phase of the cell cycle is most sensitive to radiation? The answer is G2M followed by M. That means best answer is G2M checkpoint. If that is not given in the choice, please mark M. Least sensitive to radiation? Least sensitive to radiation? Anybody wants to tell me? Late S phase. Late S phase. Okay. Fetus is most radiosensitive between 8 to 15 weeks. Teratogenic effect is seen after 5 rad radiation exposure. 5 rad radiation exposure. Clear? Cell cycle, the cells are most sensitive to radiation in which phase? G to M phase. If that is not in the choice, mark M. Most sensitive G to M, least sensitive late S. Okay. Regarding blood cells, most radiosensitive blood cells are lymphocytes, followed by neutrophils, followed by platelets, followed by RBCs. If you see the blood cells, okay, if you see the blood cells, lymphocytes, then neutrophils, then platelet, then RBCs. Most radiosensitive are lymphocytes, least are RBCs. Can you mark it? If they ask you, they might ask you in the exam, which blood cells are most radiosensitive? The answer is, okay, the answer is lymphocytes. And also remember, I see one bacha has asked a very good question, Bansri, that beta dekho, if a pregnant lady gets one chest x-ray done, nothing is to be done, just ignore it, is very minimal radiation, no, there is no problem there. Okay, clear? Okay, they might ask you, what is the most lethal event at the cellular level in radiation injury? The answer is double-stranded DNA break. Most lethal event during radiation injury is double-stranded DNA break. Most lethal event is double-stranded DNA break. Okay, now let's go further. Let me answer. About tissue, anybody? Most radiosensitive tissue is? Most radiosensitive tissue, if they ask you in the exam, please mark bone marrow. Most radiosensitive tissue in the body is bone marrow. Least radiosensitive tissue in the body is? Least radiosensitive tissue in the body is nervous tissue. Again, if you notice, this is the fact which was asked last year in the INI-CET exam. Out of these, which will not be radiosensitive? Nervous tissue. And most radiosensitive structure in the eye? Anybody? Most radiosensitive structure in the eye is lens. Most radiosensitive structure in the eye is lens. Very important question. Sometimes they ask you directly as it is in the exam. Okay, regarding tumors also, can you name some highly radiosensitive tumors and highly radio-resistant tumors? Which tumors are radiosensitive? Which tumors are radio-resistant? I will explain to you. If you see a question saying radiosensitive tumors, please look for answers as Ewing sarcoma, lymphoma, seminoma, Wilms tumor, neuroblastoma, myeloma, medulloblastoma. These will be the questions. Okay. In bone, it is Ewing's. In brain, it is medulloblastoma. Otherwise, lymphoma, seminoma in the testes, pediatric tumors, myeloma. whenever you see a question saying radiosensitive tumor, you need to recall this list: Ewing's, lymphoma, seminoma, Wilms, न्यूरोब्लास्टोमा, माइलोमा, मेडुलोब्लास्टोमा. ओके, केयूर मैंने बोला आई में सबसे रेडियो सेंसिटिव स्ट्रक्चर कौन सा होगा? लेंस, लेंस होगा उसके अंदर. ओके, केयूर हार्डिया. ओके, इफ दे से रेडियो रेजिस्टेंट ट्यूमर्स, प्लीज गो फॉर ओस्टियोसार्कोमा इन द बोन और malignant melanoma. Okay, radio resistant tumors, osteosarcoma, malignant melanoma. Again, you know, this might be asked as a direct one liner in the exam, so knowing them in one place helps you to recall later on easily. Another term that they use when they talk about radiation injury is, you might have seen this strange MCQ: stochastic effect, non-stochastic effect. I thought I will put them in a slide for you. Stochastic effect means chance effects or probability effect. Non-stochastic effects are deterministic effects or threshold effects. Okay, non-stochastic effects are deterministic or threshold effects. Okay, anybody can answer this question, beta, for me. Let's see if anybody can answer this question. Okay, very important. And then I'll, you know, I will also show you the previous slides some of you are wanting me to do, but please answer this question. Mutation, cancer have no threshold. We do not know कि इतना रेडिएशन के बाद कैंसर होगा. There is no threshold for it. So they are called as chance effect or probability effects. While things like skin burns, erythema, cataract formation, these are all threshold effects. That means they have a threshold above which we know skin burns will happen or above which cataract can happen. Okay, आई एम अगेन रिपीटिंग. स्टोकेस्टिक का मतलब होता है चांस इफेक्ट्स, वो इफेक्ट जिनका कोई थ्रेशोल्ड नहीं है. okay, the only the probability of their happening increases with radiation. These are chance or probability effect, they don't have a threshold. Non-stochastic means deterministic effect which have a threshold, like burns, erythema, cataract, mutation and cancer are genetic mutation and cancer are classic examples of stochastic effects. Okay, now let me just show the previous slide again. I think many bachas are saying. Okay, Shweta, now happy to see the previous slide? Okay, now let me show you the previous slide. So we don't need to actually remember the thresholds, just remember इनका threshold होता है. Okay, okay. Now once you are clear, let's go for, and a lot of people were saying what was LINAC, sir? LINAC क्या होता है? Let me explain what is LINAC. LINAC means linear accelerator. Let us understand what is LINAC. LINAC is a machine which produces high energy X-rays. I will explain to you. It is a X-ray machine. This is a cathode, and cathode is producing electrons. Cathode is producing electrons. In LINAC, in linear accelerator, we apply electromagnetic fields here. We apply electromagnetic fields here to accelerate the electrons, so that these electrons will now go at very high speed. So we are using electromagnetic fields to accelerate the electrons. Anyone can tell me, beta? Anyone, can you tell me? Now these electrons will have very high velocity, so they will have very high kinetic energy. So when they will strike the target, what will happen? When they strike the target, they will produce X-rays which are very high energy X-rays. X-rays which are energy of megavolt, not kilovolt, megavolt. So this X-rays, this is what is used in teletherapy. So are you now clear? I will give you 2-3 points here to remember. Why LINAC is preferred in teletherapy? Because it is a source of X-rays. We prefer nowadays LINAC. It is a source of X-rays. It can also produce high energy electrons. If I remove the target, I can directly use these electrons also. So LINAC is preferred because it is producing X-rays. What is the advantage? No isotope is required. You can vary the energy by varying the strength of electromagnetic field. Variable energy can be produced. There are no decay products. Less cost. Okay, clear? Everybody understands this or not? That the question here is that what is LINAC? LINAC is a particle accelerator, but in linear direction. It is accelerating the electrons to produce high velocity electrons which strike the target to produce mega voltage X-rays which are used to treat the cancer, teletherapy. So LINAC is preferred nowadays. What type of rays it can produce? It can produce X-rays and electrons. So what is most commonly used here? X-rays. Can we use electrons also? Yes. For superficial cancers like skin cancers, cutaneous lymphomas, and intra-op radiotherapy, we can use electron therapy also. This is called as electron beam therapy. Okay, everybody quickly answer. What is electron beam therapy? Electron beam therapy is, देखो, is using electrons produced by LINAC for superficial skin cancers, skin lymphomas, and intraoperative radiotherapy. Now, शुभम आनंद, देखो बेटा, अटोमिक लेवल पे, क्वांटम लेवल पे जब एनर्जी होती है ना तो मेगा इलेक्ट्रॉन वोल्ट बोलते हैं, लेकिन एक्सरे के लेवल पे हम मेगा वोल्ट बोलते हैं, है ना? क्लियर बेटा? Okay. Now I am repeating for Goku Tiwari, Ananya Kaushik that LINAC can produce both X-rays and electrons. Most commonly we are using X-rays for radiotherapy, but even the electrons can be used. For which cancers? Skin cancers, skin lymphomas, intraoperative radiotherapy. Okay. Now what else is left? So I think we have only 2-3 more slides to left. Okay, another 10 minutes we should be done. Now another update here is called as intensity modulated radiotherapy. Now suppose this is a LINAC. What is LINAC? It is a source of X-rays. I want all of you to listen to me. LINAC, if I put in front of LINAC a machine called as multi-leaf collimator. If I put in front of LINAC a machine called as multi-leaf collimator, I can control the energy of radiation. I can control the energy of radiation according to the shape of the tumor. That means if the tumor is thin, I will give less intensity. Tumor is thick, I will give more intensity. I will explain. This is called as IMRT. Using multi-leaf collimator, we are controlling the intensity of radiation according to the shape and surrounding structures. Shape of the tumor as well as surrounding structures. I will explain to you. Imagine head and neck cancers and imagine prostate cancer for a moment. Okay. Now everybody listen to me. I will try to give you the concept. When we are giving radiation to a head and neck cancer, head and neck tumor, we want to make sure that the radiation is given to the tumor, but we want to save the salivary gland. We want to save the salivary gland. Tell me why. Why do you want to save the salivary gland? Because otherwise radiation will cause fibrosis of the gland and the patient will not be able to produce saliva and he will have xerostomia. He will have dry mouth, no saliva. So we cannot do this in routine radiotherapy, but with IMRT, you can use collimators to stop the beam from, you can shape the beam only to affect the tumor, save the salivary gland. So in head and neck tumors, we can save the salivary gland, prevent post-therapy xerostomia. Similarly, in prostate cancer, we want to save the bladder and rectum. We all know by now that the GI mucosa is very radiosensitive. So we want to save the rectum and bladder, otherwise due to radiation, they will develop fibrosis and injury. You will have stricture in the rectum or the bladder will be injured, hematuria might be there. So to save bladder and rectum, okay, to save bladder and rectum during prostate cancer, head and neck cancers, these are the tumors where IMRT is indicated. Intensity modulated radiotherapy, 3 MCQs only. Uses multi-leaf collimator, used for head and neck cancers, used for prostate cancers. Okay. Now once you are clear with this, only 2 things to remember are these. There are some new updates, 2 new updates, only 2 new updates for you. Better don't panic. Boron, neutron, capture, radiotherapy. Okay, what is BNCT? Boron neutron capture therapy. In this we give the patient boron 10. It goes and concentrates into the tumor. It collects into the tumor. Then we bombard the patient with neutrons. We bombard the patient with neutrons. So if the neutrons strike and they react with boron, it produces alpha rays. When neutrons strike the boron, it converts and produces alpha rays. Alpha rays cause ionization and tumor damage. So this is interesting that everybody see this. Boron neutron capture therapy means आपने पेशेंट को बोरॉन दिया, वो ट्यूमर में जाके इकट्ठा हो गया, अब न्यूट्रॉन से बम्बार्ड कर दिया. When neutron interact with boron, it produces alpha rays. Alpha rays kill the tumor. So tumors are killed by alpha rays. Okay, this is called as boron neutron capture therapy. So actually the tumor is killed by not by neutrons, by alpha rays. So they might ask this new question that in boron neutron capture therapy, tumor is killed by, everybody will write neutron, you will mark alpha rays and you will come and give me the interview. Okay, boron neutron capture therapy, the tumor is not killed by neutrons, it is actually killed by alpha rays which are produced when neutrons bombard boron. Okay, similarly one more update which is very important is proton beam therapy. Very important question. Proton beam therapy is using protons to kill the tumor. These protons are heavy and charged particle. Suppose this is the tumor. If we bombard the tumor with protons, protons only cause a sharp peak of energy deposit at the target. Protons show a sharp peak of energy deposit on the target. They do not deposit any energy in their path. मतलब रास्ते में कोई एनर्जी नहीं डिपॉजिट होती, सिर्फ टारगेट पे करते हैं. This is called as Bragg's peak phenomena. This is called as Bragg's peak phenomena. Okay, this is called as Bragg's peak phenomena. So proton therapy uses Bragg's peak phenomena. Advantage: no surrounding tissue damage. It is a latest kind of radiotherapy where surrounding tissue damage is not there. There is no surrounding tissue damage. Everybody understands? Preferred for sensitive locations like pediatric brain tumors. Can you name a radiosensitive pediatric brain tumor? Medulloblastoma. Skull base chordoma. Uveal melanoma. Okay, now I'm repeating again. Proton beam therapy only indications, and we need to know it is the latest radiotherapy. Proton beam therapy is based on protons. What are protons? Heavy and charged particle which demonstrate Bragg's peak. That means protons deposit their energy only at the target, not in the path. As a result, they cause no surrounding tissue damage. So far we have used gamma rays for cancer therapy, X-rays. Now there is a machine which can use protons. Okay, so the proton beam is exciting because it has no surrounding tissue damage. It is used for pediatric tumors like medulloblastoma, skull-based tumors, uveal melanomas. Because these are the locations. In eye you don't want to damage surrounding tissue. Skull base you don't want to damage the brain stem. So because protons are very precise, they don't cause surrounding tissue damage. This facility is available in Apollo Chennai and in Tata Memorial Mumbai. Okay, very important. So let's go further. Final thing. What is PACS? Today in our hospital in radiology department we use a software called as Picture Archiving and Communication System. Picture Archiving and Communication System. It is a software which connects radiology department and rest of the hospital. Anybody? Radiology department and hospital, which software will connect them? PACS. What is PACS? Software which connects radiology and hospital. Full form is Picture Archiving and Communication System. Clear? Number 2. What is the digital format used in medical images? What is the digital format used in medical images? Okay, so in routine photography we use a format called as JPEG. For medical images we use a format called as DICOM. Digital format for medical images is DICOM. DICOM stands for Digital Imaging and Communication in Medicine. Okay, clear? Digital Imaging and Communication in Medicine. What is the digital format for medical images? DICOM. What is the software which connects hospital and radiology? It is PACS. Clear? Okay. Now what we will do here is, before I tell you what is to be done here, I just wanted to tell you that at the end of your image book, there is a test which you will do now. Okay, there is a post class test which will cover the entire of our classes, but it will have no choices. I have made an active recall test. So end of your image book there is a test. I want you to start doing this test. By the time I have invited a very special guest today, just to make sure that you are able to start with the question. So first image, I had given you a structure here which was marked. This is aorta, superior mesenteric artery, superior mesenteric vein. So the first image actually was superior mesenteric vein. Superior mesenteric vein. Question number 2. The arrow marked structure is, I'm sure many of you got it right. It was, I'm going to be a little fast in the answers, Swas muscle, so that everybody can cross check their answers. Swas muscle. In the third, it was supposed to be labeled. A is at the IVC, B is aorta, C is spleen, D is stomach, E is lungs. So if you got all of them right, give yourself a pat in the back that you're good. IVC, aorta, spleen, stomach, lungs. Name the sign. Remember, air bronchogram. You could see the air-filled bronchus outlined by the consolidation. Air bronchogram. A, B, C, D. A is caudate nucleus. B is lentiform nucleus. C is pineal. D is cerebellum. Okay. A is caudate. There is no E here. A is caudate, B is lentiform, C is pineal, D is the superiormost part of cerebellum that you can see here. In the next, we had to measure the, label the cardiac borders. 1 is SVC, 2 is RA, 3 is IVC, 4 is aortic knuckle, 5 is main pulmonary artery or pulmonary bay, 6 is left auricle, 7 is left ventricle. Okay, so these were the cardiac borders that I had drawn in the, when I was teaching you the chest X-ray part. Okay, when I was teaching you the chest X-ray part of the heart. Okay, let's see the next. Patient is in emergency. We could see the visceral pleural sign, mediastinum is pushed to the other side, trachea is pushed to the other side. What is your diagnosis? Tension pneumothorax. Tension pneumothorax. This was the tension pneumothorax X-ray that I had shown to you. Patient with abdominal pain, what do you think? I'm sure many of you saw this in the class also. Horseshoe kidney. This is horseshoe kidney. This is horseshoe kidney, beta. Very good. This digital subtraction angiogram shows, what is this? This is a cerebral aneurysm. This is a cerebral aneurysm. You could see a large aneurysm coming out of the internal carotid artery bifurcation. This is cerebral aneurysm. One is ascending aorta, 2 is main pulmonary artery. One is ascending aorta, 2 is main pulmonary artery. One is ascending aorta, 2 is main pulmonary artery. Very good. Now in this question, one is right atrium, 2 is left atrium. I told you na, right atrium towards the right, left atrium posteriorly. One is right atrium towards, and the 2 is left atrium. Patient with backache and punched out lesion in the skull. So he has punched out lesion in the skull. Backache could be because of a pathological spine fracture. We are dealing with multiple myeloma. Multiple myeloma. Very good. So in the next, we had to label on the sagittal image. One, okay, one is, I'll just label it for you. One is palate, 2 is pons, 3 is vertebra C2, 4 is sphenoid sinus, 5 is corpus callosum. Okay, 1 was palate, 2 is pons, 3 is C2 vertebra, which is your odontoid process and the axis, 4 is sphenoid sinus, 5 is corpus callosum. Okay, we are about to finish the quiz, so get ready to submit your scores. Pancreatitis, acute pancreatitis. What is this? Acute pancreatitis. I see many of you were getting it right. Well done. I'm so proud of you. Patient is in emergency. What is the sign? Dense MCA sign of acute infarction, hyperacute infarction. So this patient has an infarct in the brain. The sign is dense MCA sign. This was the dense MCA sign that we studied in the first class. Yes. Identify the marked structure. The arrow is at this structure, which is ACL, anterior cruciate ligament. The arrow is at the anterior cruciate ligament. I told you tibia ke anterior part pe ACL, posterior part pe PCL, ACL. What is this child? There is silhouette of the right cardiac border is lost, and there is a triangular opacity air bronchogram. This is right middle lobe consolidation. Right middle lobe pneumonia or right middle lobe consolidation. Okay. What is the marked structure anterior to the aorta? This is how the thymus gland looks like. This is the thymus gland that I told you, anterior to the arch of aorta, behind the sternum. You have the thymus in children. Chest X-ray of a child, boot-shaped heart, tetralogy of Fallot. The final answer was tetralogy of Fallot. So I hope you enjoyed the active recall. The entire of the DAMS concept books and the workbook that we have given to you are based on the principle of active recall. That means without the choice, are you able to recall or not? So I have given you all kind of tests in my class. MCQ based test, active recall test, identify the following kind of a test so that we can develop your thinking abilities. Now, before I speak something, I'll invite Dr. Deepti to say something to you. Then I'll give you my final message for the day, and then we can, if you have gotten almost all correct, you can send me a message with your name, address, and phone number. I will send you my latest book, Yes I Can, as an award.
I'm just going to say something very short, and I'll then ask Dr. Samir to help you with the motivation. And the something that I want to say is that, when we talk about motivation, it keeps coming and it keeps going, right? So every time you attend a live class by the faculty, they are here to push you. They're here to make you realize that you're very capable. They're here to make you realize that it's all doable. Yes, but then you will agree with me that the motivation stays for you for some time and then it again withers off, which means, you can't completely rely on motivation provided by others. So the motivation has to come from within, and most importantly, it is going to come with consistency. So I would say actually more important than motivation is consistency in your own work. Once you start being consistent, you show up for your own self, and you keep telling yourself that you're working hard. Yes, it's not about whether you are securing maximum marks or not, but you have to keep telling yourself that you're working hard, you're showing up even on your bad days. That's what is going to give you the motivation for your next day. And that's how I have actually studied throughout my life. There have been many instances when we've cried, when we feel we are not up to the mark, when we feel we may not be able to perform very well. But you have to tell yourself that deep down that you are giving it your all. You're going all out. And that itself is a big, big pacifier, because that is what we can give. We can give it all. Yes. And you have to realize that you people who are doctors, you're actually doing this for others. You're doing it for your patients, and you go all out for them without even caring about your food, your health, and you go extra mile every single time. So I will always say that do it for yourself as well. Keep yourself as your own priority. Go all out. When you don't compromise for others, why compromise for your own self? Yes. So you have to love yourself. It's very essential. That's how you will be able to love others. So love yourself for whoever you are, for whatever you have achieved so far. And once you start loving yourself, you realize that it's always going to be better and better. Yes. So wish you all a very, very, I would say, a bright future. And all of you are working hard, and I'm sure you'll achieve great success in life, become great doctors. But the message that I want to leave today with is love yourself. Okay. Keep yourself a priority. Don't compromise for your own self. Just go all out every time. Okay. Take care, everyone.
And I also wanted you all to know that after this, now that we've done radiology on the app, now I will come to every face-to-face center, Delhi, Kolkata, Tamil Nadu, I think Chennai, Pondicherry, Ahmedabad, Baroda, Surat, Mumbai, Rajkot, Trivandrum, Calicut, all the DAMS face-to-face centers, Hyderabad, Bangalore, Vijayawada, Mangalore also, Mumbai, Pune, and I think Nagpur, Jaipur also. So we have Chandigarh, Amritsar before I forget. So I'm going to come to each of your centers, and these are the things that we will be doing. I will be conducting a special test. This test will be conducted only offline, not online. On that day only the test will be conducted, followed by a discussion that I will do. And I'll also, we will also share more tips and more discussions on that center. On that day, please be there. Bring your image book so that if you have any doubt, you can ask it. Bring your planner and mark it so that I can write for you that you will become this. I have seen with many children over the last 20 years, if I have written that you become a radiologist or dermatologist, they become. So we'll do that. Ask your doubts, and if possible, get some food for me. I love homemade food. And from my side, like Dr. Deepti has said, from my side, the final message is this, and this is what I have learned in my life. Okay, what I have learned in my life is, if you ask people कि क्या मैं कर पाऊंगा, if you ask people that will I be able to do it for any question, people will always say, tell me, encourage करेंगे? No. People will always say no, नहीं हो पाएगा. You ask anything to people, they will say no. So that is why you need to believe, that bring self-belief into picture, and you need to trust your mentors and your teachers कि यार ये ठीक कह रहे हैं, मैं कर लेता हूँ. ठीक है? So don't look around for everybody to affirm. मेरे बच्चे आते हैं, सर मेरा दोस्त कह रहा है ये, मेरे वो कह रहा है. अब हर किसी के सुन लेगा तो साल बीत जाएगा, मेरी कब सुनेगा? Do you agree कि नहीं? Do you understand कि नहीं? So the problem is, if you keep hearing here and there, and nowadays, noise is so much. It is not only in the college, it is in the entire social media. Everybody is an influencer, everybody is speaking something. अब किस सुनोगे? 2 साल बीत जाएंगे, and we have to pass the exam also. So whenever you ask people, they will keep saying नहीं होगा, no होगा. I'll tell you from my own life. When I was in my school, I was from a very average school, and when in my school there was no PMT admission in my school. So when I said that I want to become a doctor, people said nahi hoga. Then I studied NCERT books well, made notes, studied NCERT books, made good notes with my own hand, remember, my own hand, and I ended up getting All India rank 4, and I joined Maulana Azad Medical College for my MBBS. Then when I came into my MBBS, and I was in MAMC during my MBBS, I was always reading and making notes. I was always making my own notes with my own hand. I told you in the class how to make notes, underline, tables, bulleted. And I think Dr. Deepti has made a great video on YouTube about making notes. So I made my notes, and people said कि यार अभी नहीं कर पाएगा, you're from average student, how can you do well? And in my college I had no gold medal. No gold medal in my college. People said, you're average, you will not be able to do. I said, no, I want to do radiology. I gave my PG entrance. In my All India exam, All India PG exam, again I had a rank 4. So only 2 things worked out for me was making notes, making them myself, and revising. So that is the basic principle of DAMS. That many times students will come and say, क्या सर लिखना पड़ता है डैम्स में, हाथ थक जाता है. मैं कहता हूँ बाद में रैंक आएगा ना तो इसी हाथ से मेडल लेगा, मेरे से अच्छा लगेगा. यू एग्री कि नहीं? कई बच्चे आते हैं सर हाथ थक जाता है, लेकिन लिखे बिना याद ही नहीं रहता. So that is one of the basic principles of DAMS, is to make notes, because it has worked for all of us multiple times, and we have seen people selling printed notes, photocopy notes, and nothing works because they get collected in your almirah as so many other books are. है ना? हैरिसन भी खरीदा आपने, ये भी खरीदा, सब अलमारी में रखते गए, नोट्स भी रख दिए. अब क्या करेंगे? कई लोगों ने तो बहुत किलो के नोट्स बना दिए. So it is important कि please write precise, write crisp, concise in the class. So this is first part of my story. The second part of my story is very important, that when I after this rank, I joined MD. I actually joined MCH neurosurgery in AIMS. But then I decided that I don't want to become a surgeon, I want to become a radiologist. So I resigned. I took a leap of faith, I took a risky decision, and I joined MD radiology. Okay, so I at first joined at AIMS MCH neurosurgery, but sometimes we all make mistakes. I also made a mistake. Okay, I did not know that I am not the kind of person I want to become a radiologist. I want to see images, make diagnosis, and you can see from my passion in the class that how much I love radiology. So I resigned from neurosurgery, went into radiology. Then what happened was that at that time many people started to know me because of this decision, because I was one person who had joined neurosurgery, resigned it, and resigned from AIMS and joined radiology. So many youngsters and juniors started to come to me and say, "Sir, कैसे पढ़ें? Boss, कैसे पढ़ें?" Okay, so that is the where we formed an institute called as DAMS, and we started teaching students for MCQs and how to study, how to make concepts. I always felt कि कॉलेज में वो कॉन्सेप्ट बना नहीं रहे. मुझे हमेशा लगता था कॉलेज में उतना नहीं पढ़ा रहे जितना पढ़ाना चाहिए. एंड आज यू वुड ऑल्सो एग्री प्रॉब्ली के कॉलेज में वो हैरिसन को या मेडिसिन को उतना डीप जा ही नहीं रहे जितना जरूरत होता है. तो we started DAMS and we thought कि we will do it for a few years and then nobody will come. But day we started it, from that day till today, we have never had any time free in our lives. समय ही नहीं रहा उसके बाद तो हमारे पास. We started it daily. We opened into the entire of the country. Right now we have face-to-face centers, largest collection of face-to-face center across the country. And we are about to touch 1 million on our mobile app downloads, where you are listening to us today on the mobile app also. So in the COVID, we started the eMedicos app. And again, my philosophy is I don't believe that a teacher can record once and sell it to people like product, aloo le lo, tomato le lo, recorded lecture le lo, ye le lo. I always believe in live teaching. So we in our platform we started to build live classes, and that is the magic that today when I see your messages and I am seeing your messages, it is giving me energy, same as when I see your faces in the classroom. It gives the teacher energy and energy to teach more. So I have always seen that when I started live classes during 2020 COVID, people said नहीं हो पाएगा. मैंने कहा कोई बात नहीं, ये तो मैं पूरी जिंदगी सुनता आ रहा हूँ, नहीं हो पाएगा तो लोग कहते ही रहते हैं. जब मैंने डैम शुरू किया और ये काम शुरू किया, पीपल सेड यार तुम एवरेज घर से हो, तुम नहीं कर पाओगे. हमने कर लिया. ओके, सो ओनली थिंग आई वांट यू टू नो इज, एंड आई थिंक दैट इज द मंत्रा दैट आई वांट यू टू ऑल टेक फ्रॉम अस इज कि यार लोग तो कहते रहेंगे नहीं होगा, लेकिन कॉमन सेंस नहीं गलत हो सकती, हाथ से नोट्स बनाने गलत नहीं हो सकते, टीचर से बैठ के क्लास में पढ़ना गलत नहीं हो सकता. So if I work hard, make notes, understand concept, practice MCQs, I've already talked about that in my previous sessions, so I'm not going to go into that, but please remember, keep telling yourself, अपना टाइम कोई लाएगा नहीं, कोई नहीं लाता, अपन खुद लाएगा. It's very very important, है ना. ये अब ना खत्म कर दो ये बात ना आज की क्लास के बाद कि सर देश में नहीं मिल रहा, गवर्नमेंट नहीं दे रही, वो नहीं दे रहा, ये नहीं मिल रहा, उससे नहीं मिल रहा, ये नहीं पढ़ा रहा, वो नहीं रहा. कुछ नहीं, अपन खुद लेके आएगा. ब्रिंग दैट, यू नो, दैट दबंगियत, आई डोंट नो व्हाट इज द इंग्लिश वर्ड फॉर इट. ब्रिंग दैट एटीट्यूड इनटू द पिक्चर, दैट ब्रिंग इट ऑन. अपना टाइम अपन खुद लेके आएगा. दैट इज द मैसेज आई वांटेड यू टू हैव.
Okay, before we actually go, some of you have been asking for how we met, and I think our Maggie story everyone knows. So I'm going to tell you the deeper part of the Maggie story. So, it's very important in life to be focused, because that's when you realize that when you're waiting, the right things are going to come at the right time. So a typical example is that when I was studying, I'm from Lady Harding Medical College. So when I was studying, there would always be opportunities to meet more people, meet more boys. But then I was very focused on studies, because I thought that I am a kind of person who cannot manage two things together, relationships and studies. So I decided that I'm going to study first, make my mark, and then sort of open up to whatever God has to give. And I would say I am glad that I waited, because the day the results were announced and I got to know that I've secured a pretty good rank right in my first attempt. That time there used to be less selections from, the current batch. And that's when I told myself, okay, now I need to ease down a little. I need to open other aspects of my life. And had I not waited that far, I would have not met Sumer. So, again, I want to motivate you on that part. Stay focused. Okay. Right things will come to you at right time. The right things that are really meant for you. Have faith in what is being created for you. what you are creating for yourself. Yes, and I'm sure you, each one of you, are going to find your better halves, best halves, and partners in life. And you must love your partners, you must love your family, you must love yourself. Okay, and these are the things which are absolutely, I would say, invaluable. So cherish people around you, and till the time you meet your partners and your better halves, spend quality time with your parents, give out love and receive love. Yes, love ki ek hi bhasha hai, give it out and get it back. Yes, so sending love to each one of you today, and I am sure that you'll all stay focused. पहले पढ़ाई करेंगे, पहले we'll make our mark, we'll prove ourselves to our own self, not to anybody. Okay, let's achieve what we are here for, and then let's open up. Let's say yes to whatever comes for you. Yes, so all the best, everyone. Take care, loads of love, and wish you a great day ahead.
Thank you very much. Take care of yourself. Stay happy. Enjoy your journey. मस्त रहो, पढ़ते रहो, मस्त रह के पढ़ो, है ना, मतलब घबराओ नहीं. Yes, I can. Wish you all the best. God bless you, बेटा.
Take care.